Good morning, everybody. And thank you so much for joining us this morning. We now have a quorum, so we're ready to rock and roll. I would like to remind us of our purpose. The Nevada Legislature created the Nevada Silver-Haired Forum Legislative Forum under statute 427A313 through 427A400 to identify and act upon issues of importance to aging persons. Let us all remember, we work on behalf of our Nevada seniors. For those attending the meeting virtually, please turn off your cameras and respond when you hear your name called. Madam Secretary, would you be kind enough to call the roll?
Ms. Starden?
If a member is not present, please record that member as present when he or she arrives. Thank you.
Ms. Starden?
Present.
Ms. Martinez? Mr. Fulmar?
Present.
Mr. Silberkraus?
Present.
Ms. Johnson? Mr. Linden?
Present.
Ms. Bongiorno?
Present.
Mr. Slaughter?
Present.
Mr. Thorne?
Present.
Mr. Smith?
Present.
Ms. Daniels? Dr. Schonkweiler? Ms. Doyle? Ms. Coffrin?
Present.
Mr. Troth? Ms. McAdoo?
I'm present.
Ms. Levitt?
Present.
President Jordan?
President. Do we have a quorum listed? How many members do you have? We have a quorum, ladies and gentlemen, so we will begin the meeting. Thank you. We want to welcome our members from the Carson City, Las Vegas, and those are online. During today's meeting, we will hear the stakeholders about transportation access and affordability issues for seniors in Nevada. Before that, we have a few housekeeping items. I would like to make several housekeeping items. First, I would like to remind everyone to please silence all electronic devices while in the hearing room. Members of the public may provide testimony in various ways, all of which are listed on the agenda. We will have 2 public comment periods, one at the beginning and another one at the end of the meeting. You may also submit public comments in writing, either in addition to testifying or in lieu thereof. If you wish to testify in person, please sign in at the table by the door and leave a business card with the secretary. When testifying in person, turn the microphone on to speak and off when you are finished, as we have others listening to and viewing the meeting in Carson City and online. Please also state and spell your name for the record. Anyone who would like to receive electronic notification and access to the forum's agendas, meetings, and final report can do so by going to the legislature's website and following the links. To access today's exhibits online, you will need to create an account on the legislative website. Instructions for doing so are also available on the website. For forum members that have access to hard copies of the meeting or materials in the binders, you have been sent an electronic version. Members of the public may use hard copies of the exhibits available at each meeting's location. Our meeting is video conference to Carson City. Members may also participate virtually over Zoom. I am asking on the Zoom video calls to keep your cameras and microphones muted until you are recognized to speak. To ensure orderly flow of discussion, all comments, questions, and responses must go through the chair. Finally, I would like to highlight that we will have a lunch period in the middle of the meeting. Members, please complete the order forms on your desks as soon as possible so staff can collect all of that. With that, we will move on to public comment. Agenda item 2. Public comment will be limited to 2 minutes per speaker. For members, please keep in mind that public comment is reserved for members of the public. When providing public comment, clearly state and spell your name for the record. We will start with public comment from those in the physical meeting locations and then move to the public comment for anyone who has a call-in. Is there anyone in Carson City who would like to provide public comment? We will move to anyone in Las Vegas who would like to provide public comment. Thank you. Our staff from the audio, visual, and hearing unit will interact with those calling in for public comment. AVH, please add the first caller with public comment to the meeting if anyone is present.
To provide public comment, please press *9 now to take your place in the queue.
Good morning, Chair and members of the important committee. My name is Dora Martinez, and I'm with the Nevada Disability Peer Action Coalition, where most of our members have physical disability and cognitive disability, and I am blind and I use the guide dog. And I encourage you all to please look for some other ways to help people with disability and seniors to get transportation, whether that's Washoe County, Clark, and rural area. Here in Washoe County, I'm an avid advocate for equitable and accessible transportation. And as you all know, with the One Big Beautiful Bill, some seniors lost their SNAP benefit, so they use their money that they allocate for transportation for food instead. And so I have a lot of folks who reach out to me, and I try to connect them with the resources here in Washoe, and I'm not quite sure what's available in the Clark County since I don't live there, but please make it available if you guys do come up with resources that available and accessible to all abilities, especially those who are using American Sign Language. Thank you for your time. Take care.
Thank you so much.
Chair, we have no additional callers for public comment.
Thank you. We will now move to agenda item 3, approval of the minutes for the meeting of February 26, 2026. Forum members, after looking at the February minutes, do you have any questions regarding the minutes?
Move to approve.
At this time, I will entertain a motion to approve the minutes from February 26, 2026. Mr. Silverkraut, are you making a motion? Can you repeat your motion, please, for the record?
Fred Silverkraut, Senate District 5, move to approve the minutes from our last meeting.
Thank you very much. Is there a second?
Joanne Bongiorno. Second.
Thank you very much. Any discussion? Seeing none, all in favor say aye.
Aye.
Any opposed? Thank you. The motion carries. We will now move to our first presentation. This morning, we are pleased to have agenda item 4, a presentation on national trends and access to transportation for seniors, affordability issues, and Nevada's policy priorities. We will have Ms. Padron and Mr. Morstead. Are you available?
Good morning, everyone. Hello.
Good morning.
Thank you. Please begin.
Hi, everyone. So we are pleased to be here today. Let me share my screen so we can begin the presentation. Okay. So my name is Jessica Padron. I am here on behalf of the Nevada State Office of AARP Nevada, and I am pleased to be joined today by my colleague Tim Morstad, who is our Government Affairs Director for our Livable Communities team. So getting into our presentation, these are some of the transportation challenges facing older Nevadans. Understanding transportation realities that older adults are facing across Nevada has many factors. So Tim created these wonderful slides for us today, and they highlight some of the key aspects, which of course are high transportation costs. Nevadans across the state are feeling this, and through our systems, we know that fuel, insurance, and vehicle maintenance continue to rise. Rural geography, larger service areas, and lower population density can create unique mobility challenges, which I know today of particular interest. We've been asked to address some of the issues for rural Nevadans. Growing older, our adult population has a unique demand for transportation options. And then, of course, traveling long distance. So essential services are often many miles for home, especially those who live in certain counties, Elko, Ely, those areas where they may have less providers, longer distance. So transportation, some of the key things to highlight here is it supports independence. Transportation is a form of independence, and we want to make sure people have access to the things that make their life run. Healthcare is a key one. You want to keep up your appointments. You want to get your necessary services, see your PCP, your other providers. Groceries and pharmacies, those are the lifeblood of any community. And as people choose to age in place, they need to have the opportunity to reach those essential services. One of the key ones that I'm sure many of the groups and folks here with us today are familiar with is social connection. It's so detrimental to our health if we don't have social connection, whether in person, virtual, but ideally in person, whether that's connections with our neighbors and our community at large, senior centers, and making sure that we can age in place by having those transportation options. So we have some unique challenges and opportunities that we're here to talk about today. But with that, I'm going to turn it over to my colleague, Tim. Tim?
Thanks, Jessica, and thank you to the forum for the opportunity to be here today. My colleague Jessica just described some of the transportation challenges facing older Nevadans. What we're finding is that Nevada is not alone. Across the country, states are wrestling with many of the same issues, and 3 trends consistently rise to the top. First, populations are aging. More people are living longer, remaining active longer, and seeking to remain in their homes and communities as they age. That increases demand for transportation options, particularly trips related to healthcare, shopping, social engagement, and community participation. Second, transportation costs continue to rise. Fuel costs fluctuate. Insurance premiums have increased. Vehicle maintenance is more expensive. And replacing a vehicle is a significant financial burden for many households. For older adults living on fixed incomes, these costs can can become a real barrier to mobility. Third, states are seeing growing demand for alternatives to driving. Many older adults continue driving safely for years, but others choose to drive less often, avoid certain conditions, or eventually stop driving altogether. Communities are increasingly looking at ways to ensure people still have options. The question that many states are asking is simple. How do we help older adults remain mobile, connected, and independent as transportation needs evolve? Go to the next slide, please. When states and communities begin addressing transportation challenges, one of the first places they look is expanding transportation options. The reality is, no single transportation model works everywhere. In some places, volunteer driver programs are highly effective. These programs connect older adults with volunteer drivers who help them get to medical appointments, grocery stores, pharmacies, and community activities. Demand response transportation is another common approach. Rather than following a fixed route and schedule, rides are scheduled when needed, making the service more flexible and often more useful in lower density communities. Rural mobility services address the unique realities of rural areas where traditional transit often isn't practical. These services may involve specialized vehicles, longer distance transportation, or regional coordination. Many communities also build partnerships. Aging services organizations, nonprofits, faith communities, transportation providers, and local governments often work together to fill gaps that none could address alone. The common goal across all these approaches is increasing access, flexibility, and independence. Let's go to the next slide, please. This map highlights examples from around the country of how states and communities are expanding transportation options for older adults. While the approaches may vary, they generally fall into 5 categories. First, we have volunteer driver programs such as Neighbor Rides in Vermont, in volunteer transportation networks in Washington State. These programs help older adults reach medical appointments, grocery stores, and other essential destinations, particularly where traditional transit is limited. Then we have demand response solutions like Arrowhead Transit in Minnesota and regional transit systems in North Dakota. These allow riders to schedule trips when they need them, providing flexibility that is especially valuable in rural communities. Then there's rural mobility services, including Ride Connection in Oregon and coordinated transit providers in Montana. These help connect smaller communities with regional services and address the long travel distances many older adults face. There's community transportation partnerships, such as coordinated transportation efforts in North Carolina and regional partnerships in Maine that bring together transportation providers, aging services, nonprofits, and local governments to make better use of existing resources. And then finally, public-private partnerships like those in Colorado and Florida leverage healthcare providers, community organizations, and private sector partners to expand transportation options without requiring communities to build entirely new systems. Although each program looks a little different, they all share a common goal: helping older adults stay independent by making transportation more flexible, more reliable, and more accessible. Let's go to the next slide, please. Having transportation available is important, but it also has to be affordable. Many older adults face transportation costs from multiple directions. There are direct costs such as fuel, insurance, maintenance, and vehicle replacement. For those who no longer drive, transportation services and fares can create additional expenses. As a result, states and communities are increasingly exploring affordability strategies. Some reduce transit fares. Others provide vouchers or transportation assistance. Some support volunteer driver programs that lower costs while expanding service. Others create partnerships that stretch limited resources further. The goal isn't necessarily to eliminate transportation costs altogether. That's frequently just not a realistic goal. The goal is to reduce the barriers so transportation remains accessible and practical for older adults. Go to the next slide, please. This slide highlights several affordability approaches being used across the country. In Washington State, Orca Lyft provides reduced transit fares for income-qualified riders. Programs like this can help make public transportation more affordable for people who might otherwise struggle to use it regularly. In Minnesota, the state's assistance programs help support transportation access through a variety of subsidy mechanisms that can reduce cost burdens. Pennsylvania's Shared Ride program offers reduced cost transportation for eligible riders, particularly for medical appointments and other important trips. Colorado supports volunteer driver programs through insurance and program assistance, helping communities sustain services that might otherwise be difficult to maintain. And Florida's coordinated transportation system focuses on making better use of existing transportation resources by coordinating services across providers. While the specific models differ, the lesson is consistent. States are finding creative ways to make transportation more affordable and more accessible for older adults. Next slide, please. Transportation is not only about having a ride available. Safe access matters too. The image on the left illustrates a situation many older adults encounter every day: a person waiting to cross a busy roadway. Even when a destination is nearby, safety concerns can become a significant barrier. Communities are increasingly recognizing that transportation and safety are closely linked. Older adults benefit from safe pedestrian crossings, accessible sidewalks and curb ramps, well-designed transit stops, and complete streets policies that consider the needs of all the users. These investments do more than reduce injuries. They expand transportation options. They improve access to healthcare, shopping, and community destinations. They make it easier for people to remain active and engaged. Safe mobility is one of the most effective ways communities can support aging in place because it improves both access and confidence. And on the next slide, I'll pass it back to Jessica.
Thank you so much, Tim. And what I love about this slide is it basically combines some of the three key themes that were just covered, right? 3 policy areas to work together and support independence, health, and connection. So looking at it from the holistic view of bringing all these things together, aging advocates all agree on these 3 pieces. We want to make sure that from someone's front door to their community, they are able to do what they need to do and age in place. Because if transportation isn't available, they become shut-ins. They may have to go to a long-term care facility, and that would incur more costs for taxpayers and lead to poorer health outcomes for the individual. And we want folks to be happy, age in place, and whether that's safely dropping off the grandkids to school, or being able to see their PCP, we want folks to have access to transportation. So one of the key foundations of that is expanding transportation options. That means more choices, greater access, increased independence. Second would be improving transportation affordability. As Tim was going through thoroughly, there are so many options, and that really just reduces barriers and creates a stronger community. Because when we have a multi-generational workforce, community, life, it's better for everyone. It creates better outcomes because we're sharing knowledge from experience as well as innovation from folks of all ages. And then, of course, thirdly, that would be safe mobility and aging in place. When we have safe streets, and the best example of that would be a young mother taking her child across on a stroller may need an additional 10 seconds for that crosswalk. But not only does it benefit that growing family, it benefits an older adult who maybe have disability, mobility concerns, whether that's a cane, a wheelchair. That extra 10 seconds is just a simple way that a community can make a small change to make it much more age-friendly and work for everyone. So having accessible infrastructure leads to healthier and more connected lives. On this slide, I wanted to go through some of those key opportunities that we discussed and that we see here for Nevadans. These are some of the areas that you all on Silver-Haired Legislative Forum may wish to explore further. First of which would be rural mobility. I love my brothers and sisters in Nevada in our rural areas. And one great organization to highlight, coincidentally, we've reconnected through this, through today's meeting, is Molly Walt and the RSVP program. They do wonderful work, and they're a great example of some of these driver networks to help people in more isolated rural areas with limited medical providers. Important areas to address that in addition to those are increased flexible and demand responsive transportation services, strengthen regional coordination and resource sharing. So that's rural mobility as one key step to focus on. Another would be transportation affordability. Cost of living is the #1 issue across Nevada, so transportation is no different. Developing reduced fare programs for older adults, especially needs-based, because so many seniors are on fixed incomes and a large portion of them depend on Social Security for 50% or more of their monthly income. That is an important factor to consider. Expand transportation assistance programs. Improve awareness and coordination of existing resources. So on that, I do want to note that it slides really well into coordination and partnerships, which is the third tenet to focus on. But improving awareness is a huge, huge thing that as a community organizer, I think is an important aspect, because there are so many pilot programs, nonprofits, groups, organizations, or government resources that are available on certain needs that communities may face. But if there's not proper awareness to meet people where they're at, whether that's the community center or creative new ways of reaching out to them, that's going to limit participation, and thus far it may seem like there is limited interest, but that's not the case. We need to make sure we are doing our part to educate and reach people all ways possible. And that will lead me to our third, which is coordination and partnerships. Strengthening partnerships between aging services and transportation providers are a key element of something to consider as a policy solution, as a working group, or things that this committee and other legislative entities and state and local governments here in the state of Nevada can pursue, and working in collaboration and planning. Finally, innovation and pilot programs. So launching and supporting community-based transportation pilots are a great solution. I actually have a little bit more on that shortly. Explore innovative solutions and scale and sustain successful local initiatives. So as we know, there are so many sources of funding for transportation, federal funds, state funds, and I want to make sure that people do what they need to do so that it flows from the top down to the very local resources, because they may know how to allocate better and better serve their local community. And also they can inform all the way up too. Everything needs to be a symbiotic relationship. With that, I'm going to go to our innovation pipeline. So I am so proud to show Nevada in action and highlight that today, my state director is not here with us today. He wanted to participate as well, but he's not here because he's been doing the Community Challenge Grant winner announcements. And Henderson is one of those winners this year. They've won in the past, but something I wanted to highlight as a great example of what we're discussing today is the demonstration grant that they won for our 2026 challenge grant. If you're not aware, AARP every year provides challenge grants to local governments, nonprofits, any organization that is willing to put a plan together for a short-term project that will make their community more age-friendly. And this year, Henderson was one of our grantees with a housing design challenge that will create mixed-use, transit-oriented concepts for city-owned land. The ideas will demonstrate how age-friendly housing can support aging in place, walkability, transit access, and community connection. So I'm very excited to see how that comes to fruition. And of course, Reno is my shining star because I go up there quite often to work with our age-friendly Reno and Washoe volunteers. And Downtown Reno Partnership a while back completed walk audits in 3 different dining districts to show how walkable Reno is, and provided some recommendations and helped push along a lot of the age-friendly work we do today. So with those examples and all of the information that my colleague Tim was able to pull together, I just wanted to say thank you all for inviting us to participate. Our contact information is shared below. It's our first initial and last name at aarp.org. But I'm based in Nevada, so if there's anything I could do moving forward to stay in connection to work with you and our legislators, I am happy to do so. And I thank you all for having us here today.
We thank you for being here today. Are there any questions for the forum members, from the forum members?
Yes, I do. Yeah, Frank Slaughter, District 11. I really like your presentation. I think it was well, I really understood it, and I'm very passionate about it because for over 7 years, I've been working with seniors, mainly seniors with neurological disease, mainly Parkinson's disease. And I understand that a lot of people that come through me over the years, you know, they don't have the funding to come to these programs. I've been volunteering. I don't take any money out of this program. So what I do with this program is, what I'm looking for this program is, there are a number of people that come to these programs that have disposable income. But I have never had an African-American or a Hispanic come to this program. And my idea was, maybe this person lives on the other side of town and can't come to this, you know, have transportation to come to this program. And as we all know that if you're sitting home with a remote control eating potato chips, you're going to exacerbate your neurological disease, whatever it is. And so I've been thinking, one of my brainstorms, and it hasn't gotten off, was going to all the neurologists in Clark County and identifying those patients that have neurological disease, especially Parkinson's, which we work with, and then have a pamphlet and have them be able to come to our program, but they're going to need transportation. And I was wondering, the same transportations that bring the people to hospitals could bring them to a program such as ours, bring them there safely, pick them up safely, and bring them home. And that will, honestly, that will reduce the cost of these patients coming to emergency or other facilities ahead of time. What do you think about that?
Well, I think today's meeting will give us a lot of opportunity for discussion to maybe create a BDR on a transportation solution of something either we or one of the other presenters present that folks on the legislative forum want to pursue. And if that's the case, we're happy to continue providing resources, information, and how we can move forward. But yeah, like we covered in the presentation, there are so many opportunities to create affordability and reach out to the folks who need it, meet them where they're at. So I hear exactly where you're coming from. And I've been there as a community organizer, in many cases, trying to reach out to targeted communities and not seeing the response I was looking for until I changed my outreach tactics. And sometimes that does take a lot more resources than are provided. But hopefully, that's why we're here today, to see what resource options are available, what the economic forecast looks like, so that we could plan accordingly and provide those resources where needed. And if y'all make the correct appeal to our legislators, we are happy to offer support and find those creative solutions.
Thank you, Mr. Slaughter, for the question. The chair will recognize any other questions. The chair recognizes Mr. Slaughter.
For the record, Fred Silberkraus, Senate District 5. I have a couple of questions, but more observations. Obviously, our committee is concerned with the elder population, not necessarily the transportation requirements of the city at large. It's my understanding that, and I could be mistaken on some of these points, that most of our senior population is covered under Medicare or a form of Medicare, either the government or PPOs and HMOs. Within that type of coverage, it's my understanding that those companies provide up to 52 prepaid trips per year for medical appointments at no cost. I'm curious how many people who actually take advantage of that. I'm speaking for myself and my own particular plan, but I believe most of them are very similar in allowing that type of service. And it is door to door, and it is on demand. I believe it's up to one round trip per week per medical appointment. If that's truly the case for a large percentage of our elderly population, why is that not a major cure for getting elderly folks to important appointments? The other thing is that the rebuilding of our transportation system here in the city, and I take this rather personal because you zeroed in on Henderson, and I happen to be a resident of Henderson. Henderson received tremendous amount of money from the federal government to improve the safety of our roadways. In my opinion, they've done an absolute travesty of using that money. The Imagine Boulder Highway project has been a complete farce from day one. For those people that are familiar with Boulder Highway, it is a major corridor going through Henderson up into Las Vegas. It was basically a divided highway, very large. The city of Henderson held several meetings for public input on how that money was to be spent. They completely ignored all of the recommendations that were made by many meetings that were held by the citizens where they were called in for advice. They elected to divide the highway with a bus lane running down the middle. Prior to that, if you lived on one side of the highway or another, chances were you had a 50-50 chance of not having to cross the street to get a bus, to get public transportation. By constructing this project, they've guaranteed that anyone using rapid transit is now going to have to cross at least once, if not twice, one of the busiest roadways in Henderson and Las Vegas. Boulder Highway has been known by some as Slaughter Highway. The number of deaths because of pedestrians having to cross the street to get to the other side is astronomical. There was no lighting, no sidewalks, and you had to get a bus on one side of the roadway or another. By putting in this new system, which was really discouraged by the people in the city, they've basically thumbed their nose at the residents of Henderson in terms of what they wanted in the way of an improvement to rapid transit, at least through their city. They're attempting to do the same thing again now on Lake Mead Boulevard, which is an extremely wide street, very difficult to cross, 5 lanes in each direction. And they want to put a busway down the center, which would again guarantee any user would have to cross at least twice to get to a bus and back to their side of the street. So I question highly the responsible response to some of the avenues that are potentially made available for rapid transit, aiding in our senior population being more mobile safely, and what is actually taking effect in these different cities. Now, I know you're speaking from a ARP standpoint, but the state of Nevada, the city of Las Vegas, Metropolitan Transit, all have a major role in deciding where to run buses, how to run them, and the schedules, availability. And it's my personal opinion that they've done a pretty bad job over the last 10 years, last 15 years, actually. I see buses all the time running basically empty. People are not taking advantage of what's there. I don't know if it's because of scheduling or the costs, but the ridership levels on the buses that I've witnessed throughout the city appear to be abysmal. And that, I think, is another major cause why people feel or don't take advantage of the transit systems that we have, not only for the elderly, but for our general population. Somewhere in our system, there has to be a mechanics for review of the utilization, the routing, the costs, and the way federal and state funds are being used to improve our roadways. I don't know the answer to what agency would be responsible for doing that, but it bothers me a bit to hear about how much we're improving, theoretically, access for our aged population, where in truth, I believe exactly the opposite has been happening. I'd like to see a remedy, a program to remedy that situation. Thank you.
So, Mr. Silvercross, you covered so many things, but I would like to just say, so like you said, we are from AARP Nevada, and as a Battle-Born Nevadan, I will say that there is one of the main things I do want to point to in a need across the spectrum, all policy areas, that we do better outreach, right? I covered that a little bit earlier, but I do think it is very important. Like you said, in some places, ridership may be lower for a variety of factors, but RTC would be the best resource on that. They do have a wealth of research information. And to my knowledge, I've seen several efforts in the last year on community conversations, town halls, surveys, things like that for folks to participate. But once again, it's an outreach thing. Maybe we need more people to be aware of it, whether it's through their HOA or what have you. But on our end, I do think it is really important to note that plans do vary. Your very first point on transportation, if everyone had access through their medical plans to get dozens of free rides a year to their medical providers, that would be lovely. And I do think that some plans do offer some of that. I am not familiar, though. I can't speak to that. I don't believe my colleague is aware of any major wide scale thing like that that's available to Nevadans currently, right? But plans do vary. And if there are some that are widely available to Nevadans through the health exchange that they can sign up for, it's important to alert and educate them to that. But I look forward to continuing to be part of the discussion. And while I may not be the entity or deciding factor on a lot of these things, AARP Nevada does do a really good job of spreading awareness on issues. And I would like to proudly say, I think in the last couple years, since I've joined the team, hand in hand with my colleagues, we've made a concerted effort to dramatically increase our public community visibility and activations in Henderson, in Northern Nevada. We even did a health fair in Winnemucca a couple years ago with one of our very active volunteers. So keep us in mind if there's anything we can help with, but thank you for your question.
You're very welcome. Just as a by note, one of the largest insurers here in the state of Nevada is United Healthcare, and they offer a very wide variety of Medicare programs, basically HMOs and PPOs. To my understanding, every one of those policies, every one of those programs does offer 52 trips per year. Whether people are not aware of it, who have that coverage, would be a shame, knowing that it is an available option and not taking advantage of it. Maybe there needs to be some further education of these policyholders so that these options and other adders, so to speak, under HMO and PPO programs are available to them, and they're just not aware of it. That seems to be a great waste of a potential resource if our elderly under those programs have that opportunity and are not aware and using it actively. Also, one other note, and again, I'm speaking for the city of Henderson because I'm a resident there. Henderson holds their city council meetings every month, asking for individual input. I've attended virtually every meeting in the last 2 years. I have found personally the city council and mayor to be completely oblivious to the comments that are being made by the citizens. And they seem to be making their decisions how to spend federal state aid money on programs that they themselves approve of, but are not necessarily favored by the residents. And I'm extremely upset about that happening as we speak right now. The Imagine Boulder Highway project has been lagging for 2.5 years, and the majority of that roadway, which is a major roadway, is virtually unusable.
Thank you very much, Mr. Silberkraut. We certainly understand your passion for this area, and we appreciate your questions. Are there any other questions from the forum members?
Madam Chair, Joanne Von Giorno, District 10,
recognized.
also a resident of Henderson, Nevada. I am inclined to totally agree with my colleague here. I've seen that happen. And I've been a resident since 1977, the inception of Green Valley. I see the appropriation of some of those funds. For example, what he's saying, they build sidewalks on St. Rose Boulevard. Nobody uses them, instead of appropriating the money where it should go. Also, I am a member of ARP, and every now and then I receive an email from you that says benefits. It would be advantageous to us if you would also mention the fact that we have transportation available to us. I have never seen that benefit in any of the ARP bulletins that I receive through email. Would you check that, please? Thank you.
Thank you so much. I will take it back to our comms director. We do have a lot of benefits for members through our national membership program, but in our local emails that are targeted to the communities, we send out a bunch of events, especially Henderson's one of our active areas. So we do strikeout fraud bowling nights, all kinds of things. So if you're not getting the emails, check out our local AARP.org/NV Nevada resources, but I will make note of that, and thank you so much for sharing.
Marilyn Jordan, District 9, for the record, I have a question. I'd like to know if you could share some promising practices that are available for our rural and frontier communities. I am very concerned and have been over time that we are not servicing those communities in the best possible way. And I'd like to hear some suggested measures or improvement ideas that you might be able to share with us. Thank you so much.
Thank you very much. Well, in our presentation, we did go through some of the applicable policy solutions that are successful in other states. But a current one that I would like to highlight again, the RSVP program in rural Nevada does a really good job of coordinating transportation for Nevadans. And I agree with you, there is quite a significant number of unique challenges that our rural Nevadans face that we don't maybe necessarily see in Washoe County or Clark County, including limited medical providers. So a lot of those rides have to be coordinated appropriately. But I would suggest seeking out what current organizations are available in providing resources, and if it is appropriate to provide more funds to them, offer them more resources, maybe partnerships with the local communities. And then in our specific guidelines or what we recommend, I would defer to what my colleague Tim Morstad put together from our other states that we're seeing more of those volunteer ride programs, affordability, means-based resources for those who need them. And to clarify some of the points from earlier, specifically maybe doing more outreach of what's already available that folks aren't necessarily aware of or fully taking advantage of.
I appreciate your answer to the question, and I appreciate the fact that we know what's going on around the country, but we are here to support Nevada, and so our interests are what's going on here. Are there any other questions?
Dr. Jordan, I just have a comment. I'm on the Southern Nevada Transit Coalition, which serves primarily Boulder City, Laughlin, Mesquite, and Good Springs, which is considered rural Nevada. And I think we have, at least in Boulder City and Laughlin and Mesquite, really good transit services that are provided mainly through Silver Rider. We also in Boulder City have Lend a Hand, which is a nonprofit and has volunteer drivers, and they take seniors into Las Vegas for medical appointments, anything they need. But Silver Rider, which is a bus, you know, a small bus, you see them driving seniors to Albertsons for groceries, taking them to the senior center. It's a great program, and it's very affordable. I don't know that it costs seniors anything. So, and I've been on that board for many years and have seen nothing but improvement in what's going on in those particular localities.
Ms. Levitt, we always like to hear things that are promising and things that are helpful. That's what we're here for. So I appreciate your comments so much.
And just with respect to the funding, I think that comes through the RTC.
Okay. Do we have any other questions?
Madam
The
Chair.
chair recognizes Mrs. Darden.
Thank you. And it's Miss.
Speak up so we can hear you, my dear.
It's Miss Darden. Senate District 1. I'm a freshman here, but I do have a suggestion. At the age of 70, going to the DMV, they ask you to take a eye test and, you know, in order to drive again. And I can tell you, having a father that went at that time was 95 years of age, he took that to heart when he was told he could no longer drive. So my suggestion is that the DMV then would give the options that you're discussing as far as how they would get around, because he had no options. And this is the first time I've even heard that this was available to him.
A DMV senior resources one-pager is definitely a great idea. One way we tackle that here locally in Nevada is every year we update our Nevada Caregiver Resources Guidebook, and it has all the local nonprofits, entities, including some of our state government and local government resources on a variety of caregiving resources for family caregivers caring for their loved ones. So maybe something along those lines would be a great recommendation from this forum of senior-focused transportation resources? And if so, if possible, break it down by county so that it could be spread out amongst, or do a pilot in one county where it could all be. These are all just options, suggestions off of Ms. Darden's great suggestion.
Thank you so much. Are there any other questions? Seeing none, I want to thank Ms. Padron and Mr. Morstead for their wonderful presentation this morning. Please let us know if there are updates or how we can continue to support you and you can continue to support the forum. Thank you and have a great day.
Thank you very much.
Thank you.
At this time, we will address agenda item number 5, a presentation on the Douglas Area Rural Transit, also known as DART services for seniors, affordability challenges and policy opportunities. And we will have Ms. Brooks, the Community Service Director from Douglas County. If you're available, we want to hear from you. Carson City.
Good morning, Brooke Ady, Community Services Director for Douglas County. Can you guys see the presentation? I just want to make sure I got it up correctly. Yes. Okay. Well, I will go forward. Thank you for allowing me the opportunity to give a presentation today. I'm going to talk about DART, our Douglas Area Rural Transit Program, as one of the pieces of our greater coordinated care system of care that we have in Douglas County. Our rural transportation is a very vital resource, but it is so successful because of all of the other resources that we do at the same time for the members of our community and for our seniors. So I'm going to talk about our department. I'm going to talk about all the services that we provide. I'm going to talk about the history of DART. I'm going to talk about some gaps in services that we're still seeing, and then some new services that we're looking to implement very soon. So our Community Services Department is pretty unique for Douglas County. I think most areas around the state and around the country don't have such a robust community services department. So I am the director over multiple different divisions within my department, which provides a great opportunity for us to coordinate very intentionally a lot of services that we provide. So within our department, we have our animal services, which does adoptions for stray animals, and they are in control of the rabies vector. So our animal control services are out in the community a lot, and they often go out to seniors' homes, and they are finding them in need for services, and they're able to work with our other managers within our department to help coordinate referrals, concerns, and different kinds of resources. So some of these don't always seem like they fit, but there's always a nexus because we are serving our greater community, and when we find people in need, we're able to help support them. Our weed control department, so we are in charge of noxious weeds. We have our senior services, which has congregate meals, services. We do senior trips. DART transportation is part of our senior services. We have one main senior center, and then we have 2 additional community centers that also operate as a senior center. We have our parks department, we have our recreation department. Our main senior center and community center is an 84,000 square foot multi-generational facility. On one side of the building, we have all of our recreational services. You walk down a hallway which has all of our different meeting rooms, which were used for exercise programs. We do American Sign Language. We have line dance classes, tap dance classes, all kinds of senior art programs. We have an art room that has kilns so people can do pottery classes. We have all kinds of services in between. And then the other side of our building is where our senior center is. And our senior center operates, we do congregate meals 5 days a week, and we serve anywhere from about 180 to 250 meals in the facility daily. That main area all of our food is prepared in our main senior center. And then we have congregate sites, which we go out to. We have one up at the lake in Lake Tahoe at the Kale Community Center on Thursdays. And then we also offer South County in our Topaz Ranch Estates, and then in North County in our Indian Hills area a few days a week. We have our recreation department, our public administrator. So we are in charge of handling estates for people who die without having a will or intestate. We have our social services department, which also provides our adult day club. So in our main community center that I was just talking about, we have an adult day club. DART Transportation provides transportation for people to come and participate in that program. It is a licensed adult day club. We operate on a social model, and we probably have anywhere from 18 to 24 individuals who come on a daily basis. And that program is really intended for people with cognitive deficits or that need more supervision or support during the day. This program is pretty amazing because it does provide a lot of respite for loved ones and caregivers if they need to go to work or go shopping or really take a break. Our adult day club also provides hygiene services. So if you have a loved one that is really struggling with being able to take a shower and you might not be physically able to assist them, they can come to the adult day club, and the adult day club can help make sure that they are showered once or twice a week. We have our Homemaker program, which is a program that is partially grant funded with aging and disability services. And so we go out to people's homes and we provide light housekeeping about 1 to 2 hours every week or every other week, do some meal preparation. They do transportation if our DART transportation is not able to provide the transportation that is needed, but we really try to use DART as our main resource so our homemakers can really focus on providing in-home services. One of the other programs we do is our home delivered meals program. And so whatever is being cooked in our senior center is the meal that our individuals who are homebound will also receive those services. We have DART transportation, we have a public health clinic, and then we also have our public guardians office. So we do a lot within Douglas County, and really our mission is to make sure that we are providing services to everybody in our community based on what their needs are. DART transportation our mission is committed to providing transportation to the residents of Douglas County. So we do offer 2 different options for the general public. We have senior riders, and then we have riders for individuals with disabilities. All DART buses are equipped with wheelchair accessibility and bike racks for accessibility and convenience. So as a community, we are stronger together. I did talk a lot about the services that we provide within Douglas County Community Services, and I really want to take this opportunity to elaborate a little bit more. When you look at the org chart for how our department is set up, oftentimes people say it doesn't make sense to have all of these pieces under one roof, and we disagree because we think that it does, and we've been able to work very hard over our main senior center has been open for the last probably 12 years, but we have been providing this coordinated care of services for decades. And so with all of these departments under one roof, I meet weekly with my managers, and we are able to talk about the people that need services. Maybe somebody comes in and they've been coming into the rec center and they've been working out. They've been doing our free senior walking program, or they've been doing our free senior exercise programs, and they're starting to decline in health, or our rec site hasn't seen them in a while. And so maybe they'll talk to the director of our social services department and say, hey, have you seen so-and-so? I want to make sure they're okay. We talk to our senior services department and we say, have you been seeing them coming in for lunch? We're able to really keep an eye on our seniors and help refer them to resources as they age and as they might need additional services. Since they're coming into our facility, they're getting familiar with our staff, they're forming relationships. It makes it much easier for them to ask for additional help as they need it. Our building is busy from the time we open at 5 a.m. to the time we close at 9 p.m. We do senior services. We have a preschool. We do multi-generational activities with our preschool and our adult day club. We do youth sports. So there are a lot of opportunities for people to come and interact in the greater community. We really say that this is a health and wellness hub. And so we don't operate in silos. We are able to work together to coordinate services to make sure that people are getting the things that they need. So here's a picture of our community services department. There's actually another part of the building that isn't being shown, and that's our senior side. But within this department, we provide health services through our health clinic. We focus a lot on women's health and reproductive health, but we do provide vaccines and flu shots, and we have our nurses go to our senior center and we do blood pressure checks and all that. We are able to help people remain independent. We provide nutritional services, resources and referrals, transportation. Because of the coordinated effort that we have been able to provide in Douglas County, we have been able to allow more seniors to age in place, to be home, to provide resources in home. People do better when they are in their home. And if they're able to stay in their home and get meals and homemaker services and transportation to medical appointments, then we're successful. We're doing what we've set out to do, is really to support people living independently. Our DART transportation will pick seniors up at their home. They'll bring them to the community center where they do art classes, they do exercise classes, they stay for lunch, they socialize, they play bingo, and they go home. They're really able to get out of their home and participate in the programs that we provide. Because of all of the services that we have been able to provide, our long-term care costs that the county is responsible for paying are significantly lower than our neighboring communities. So we look at the rates that we pay compared to Carson City and Lyon County, and Douglas County is significantly lower, and we like to attribute that to all of the services that we're able to provide to keep people independent and healthy and connecting them to the services they need. Okay, that's a lot about what we do. I'll talk more about what DART does specifically. So our DART program was established in 2001. It was established through some grant funding that NDOT had at the time, some rural public ride program. I think there were some tobacco settlement funds that were used initially too to help fund and purchase vehicle expenses were about $50,000, and we had about 20 riders each day. So this is where we were in 2001, and our program has grown significantly since then. Our DART operations currently, we have 14 positions. So we have a supervisor, an office specialist who helps process applications and making sure that we have all of the documentation we need in order to give people rides. And we have a dispatcher who is the one has the most complicated job of coordinating all of the dial-a-rides that we have throughout the community to make sure people can get to the store, their medical appointments, and things like that. We have 7 full-time drivers, 2 part-time drivers, then we have 2 on-call drivers. Due to some additional funding that we were able to get, we just recently this year purchased 2 new buses and 2 new vans. So we have a total of 12 ADA buses. We have 1 ADA transit van, 1 non-ADA transit van, and then we have 2 caravans that have wheelchair lifts for people to get to their individual appointments. And then we also received a Campo grant, and so we're in the process of getting another transit van, which will be wheelchair accessible. So DART operates in 2 ways. So we have a fixed route, which is a route that runs on fixed times and fixed stops throughout our county, Monday through Friday between probably 8 and 5:30. And then we have our dial-a-ride, which is intended for seniors and individuals with disabilities. And that is a door-to-door service that we provide to get people to medical appointments, to shopping, to the senior center to participate in activities. And that is a very successful program that we do. So a lot of our riders are dial-a-ride. The area that we serve, so Douglas County has about 50,000 residents total, and it's about 710 square miles. So we've got Minden, Gardnerville, Topaz, we have South Lake Tahoe, or State Line and Zephyr Cove area. The main bulk of our transportation is done in the valley. We do dial-a-ride for individuals up at the lake to get them to medical appointments, but the Tahoe Transportation District is the one who does the fixed routes really up at the lake. And so when we're looking, here's just some information on the number of individuals we have in each part of the county. Douglas County is home to one of Nevada's highest percentage of older Nevadas, older adults, which is about 35%, and we are seeing a significant growth in our senior population. So Douglas County does have a very high senior population. So our fixed route stops location, so you can see in Douglas County, we go to Walmart, we go to Smith's, we do go to Carson Valley and the library, the swim center, the bowling alley, the hospital. We try to have some key points in the valley where people can to go to participate in the activities they need or the medical appointments. Our main community and senior center is a transportation hub. So if individuals get to our main community and senior center, they are able to connect with the Tahoe transportation buses, which could take them up to the lake or into Carson City. So they are able to connect to other transportation systems that could get them outside of the area. We are starting next week, July 1st, we are implementing some new routes into our South County area. We've been able to do that with additional grant funding that we have been asking for over the last couple of years for 2 new full-time DART drivers and then all of the vehicles I talked about purchasing. So when we looked at expanding the route, we did a lot of community engagement, which I'll talk about in just a few minutes. And so you see where our transportation hub. So DART, if you go to our Douglas Community and Senior Center, you can catch DART, you can catch the Tahoe Transportation District, and then you can get onto the Jump Around Carson City buses. And so it can really help expand you out to the greater area. Here's some data on our overall ridership, the number of rides. So the top graph really talks about our dial-a-ride and our fixed routes. So that's all of the combined rides that we have done each year and how many we've done year to date. And then we have our fixed route. Our fixed route does have smaller numbers than our dial-a-ride. So these are not individual riders, they are individual rides. So we looked at, so far year to date, we've done 31,030 rides, trips that we've done. Here's the different funding sources. So we do receive funding from 2 different ways. So we have Aging and Disability, a transportation grant, and then an NDOT grant. These grants pay a portion of the salaries for the staff that we have operating the program. Mostly ADSD is looking at funding our transportation for our seniors and our individuals with disabilities, but that goes to reimburse their salaries. Our NDOT grant supports a little bit more. We have some capital money so we can purchase new vehicles or if we need to fix vehicles. We get some money for fuel. Our fuel costs have really gone up, and so we're closely monitoring our budget to make sure that we're able to provide the number of rides that we have based on what our fuel costs are. And we really take a coordinated effort to make sure we're maximizing our resources. And so if we have, one person down in South County that needs to get to North County for an appointment, we try to coordinate that with some other South County riders. So we're not making multiple trips, but we're still supporting the needs of our individuals. If you look at our ADSD transportation grant, it's been pretty flat. There was one year, I think, where there was some funding that didn't get spent by other programs, and so they reallocated that to us. I did just get an email this morning for our next ADSD transportation grant that we did get a 6% increase, and so that's nice because we use these funds to pay for salaries, and our salaries increase each year, so it's helpful that our grant funds increase each year. And then you see the green portion down on the bottom, and that is the portion that the county is responsible for the county match. Here's the DART fares that we charge. Our rates are very low. Seniors, it's a suggested donation of $1. We have passengers that are on Medicare or people with disabilities is $1. Students with IDs is $1. Adults ages 12 and over is $2. If you're an individual that is traveling and you need the assistance of a care attendant, the care attendant does get to ride for free. We have a companion rate, and then we do some ride passes that we're also able to support. But we don't want to turn people away if cost is an issue. So we're able to work closely with our social services department to make sure that people have the funds necessary to pay for rides if that's what they need. So here's a little bit more on our South County fixed route. So there had been talk, one of our county commissioners lives in South County and has been talking for, I think, 5 to 7 years about wanting to expand services. And so nothing in government usually happens very quickly. And so 7 years later, here we are, we're ready to start next week. And that is because we have asked for additional funding in grants for staff and new vehicles. We did a lot of public outreach. So we did a survey for residents in the community to say, what is it that you need? What is the frequency of times that you're wanting to get into town? Where are stops that you would like to go? How many days a week will you use it? Where do you want to be able to go? So we did a survey. We did 2 public workshops. We went to the GID meeting and gave a presentation, really just seeking feedback on if we're bringing a new service to you, we want to make sure that it's a service that is going to support your needs, and we're not using our resources to create something that isn't going to be utilized. So we have somebody down there who they like to get to the swim center. Okay, so they come to a pickup point down in TRE, and then we take them to our community center, and then they can connect to get to the swim center. There's also a lot of youth out in that area that might want to be able to come into town for the swim center, so they can connect with our DART transportation bus. The next step in our route expansion is looking at our already established fixed route. We've had a lot of growth in Douglas County, and so there are stops that we probably need to increase stops in just different areas based on the growth and housing and just commercial in the area. And so our new fixed route is going to operate 5 days a week with at least 3 trips daily. We're going to do a 1-year pilot with some check-in points in between to say, is 3 times a day enough? Is it too much? What does our ridership look like? How are we supporting people? And then determine what the program looks like moving forward. But if we don't provide a reliable and consistent form of transportation for people in South County, they're not going to use it. And so that's why we're really saying, hey guys, we've got a year, you got to use it. You got to tell us what it is that you need so that we can continue to support it in the future. Some challenges that we see with rural transportation is, and I've heard this talked about already, is providing services across large geographic areas. So, Douglas is spread out pretty far, limited transportation alternatives, increasing demand for public transportation, medical appointments outside of Douglas County. Now that we're pretty well staffed, we're looking at how we can get transportation for individuals who need to go outside of Douglas County, because we do have limited healthcare providers. Douglas County has used the SB 118 public health funds that we had received during I think it was not the last legislative session, but the previous one, which is going to be continued to be funded. Some public health funds that are coming to communities to say, here, use these funds to help support public health needs in your area. A need that we have identified is access to healthcare. We have a need to help people get connected to their insurance, Medicare, Medicaid, help get them connected to medical providers and transportation. With those funds, we hired a community health worker. We have purchased an ADA accessible van, and we have that community health worker who can take individuals to medical appointments and actually sit in with them in the medical appointments if it's needed. Oftentimes when you go to a medical appointment, there is so much information that is given, and it's hard for an individual who is by themselves to remember everything. And so we do provide that support as an option if somebody would like it. Additionally, with those SB 118 funds, we have been able to go into a contract with a medical transport company. So if our DART drivers or our community health worker isn't able to physically help somebody on and off the vehicle and to be able to transport them, we have funds allocated for those medical transport companies to get people who might be more physically compromised, getting them to their appointments. So some operating challenges, so higher operating costs like fuel, wear and tear on vehicles, maintenance, things like that. We have noticed a reduction in active CDL holders. So being able to find qualified drivers that have appropriate license upon getting hired to be able to provide the services. Douglas County requires that you get a CDL or that you have your CDL upon hire, and then we work with them on their passenger endorsement. We have talked about, do we have the ability to hire drivers and then require they get their CDL within 6 months? But we don't have costs. It's $4,000 to $5,000 to pay for somebody to get a CDL. And so we're running into issues where we have drivers that are able to drive the vehicles that we have. There are lots of grants out there that are specific for electric vehicles. We don't have electric vehicles. We don't have the infrastructure or the maintenance staff to work on electric vehicles. So that really eliminates us from being able to apply for that. That has been a challenge. And then really balancing our fixed route needs with our deviated fixed route. So that's if we're on a fixed route, but maybe someone in this neighborhood needs to get picked up, we'll kind of deviate from the fixed route, pick them up, and then continue on. And then our on-demand response services. Some infrastructure, we do need larger facilities to be able to, for parking our vehicles, maintaining our vehicles. Douglas County does have limited sidewalks and connectivity. So one of the hats I wear under my recreation side is looking at trails. And I did a trails plan to help connect the community to make it more walkable. But a lot of the places where we have stops, there are not a lot of amenities for them or ways for people to, to sit and wait for a bus. And so sidewalks are limited. And then expanding transit service in areas where it wasn't initially designed for. So some additional gaps in services. Our community is growing, and it's growing at a quick pace, and the need for transportation is increasing. We could do a better job at getting people transportation support to access employment. Our route is only Monday through Friday from about 8 to 5:30. That doesn't really help people get to a job. And so our primary focus really has been seniors and people with disabilities. If we're able to expand more to provide more employment services, we think that could really support our community. Regional coordination, you can get from Douglas County to Carson, but there are still some gaps in services, and maybe the timing doesn't quite line up quite right. And so our transportation supervisor, I know that she has been reaching out to and talking to transportation supervisors in other areas to say, how can we work together to better coordinate services? Medical appointments outside Douglas County, like I said. And then we are working on a volunteer recruitment program to get volunteer drivers, whether they're driving for our Meals on Wheels program or they're driving for our program. We have a group that uses space in our building called Expandable Horizons, and it's a group of adults with disabilities. And we have had drivers in the past using our DART vehicles, making sure that people can get to and from this program that we have every day. Those volunteers have said, we're going to move on to do something else, and so we would like to have more volunteers to do that. Volunteers to do home delivered meals, which I think I said. And then, really looking at volunteer drivers for some of our senior programs that we do. Our senior program recreation coordinator last week, or just this week, she took a bus full of individuals up to the Reno rodeo and they got to go see the rodeo. So she does a lot of trips, and getting more drivers to be able to help support her would be great. There are things that we do really well too. We have a great coordinated system of service, like I had talked about already. Our dispatcher is very easily accessible, and she works hard. You call and you talk to a person, and you talk to the same person all the time. We've been able to establish relationships with our riders, and she can help coordinate to make sure that your appointment can align with our driver's schedule. She could call doctors' offices if needed to say, hey, we can't get this person here till 2. Can we adjust the appointment time? And we have some new vehicles that are really able to support our community. So there are lots of things that we also do very well. That is the end of my presentation. I'm happy to answer questions if anybody has questions.
Thank you very much, Ms. Addy. This is Marilyn Jordan, District 9 for the record. I have a couple of questions. I want to thank you for such a comprehensive presentation. Very, very interesting. I wanted to know how residents communicate the need for transportation. Do they call? Do they request it? Do they go to a bus stop? I mean, all these exciting things, but I'd like to know how they communicate with you and the DART program or the Dial a Ride or whatever.
Yep. So there are many points of entry to where people can begin accessing services. So our social services department, our senior center has people there Monday through Friday from 8 to 5. And so we get a lot of people coming in and asking questions for resources. We've created magnets with our DART logo and the phone number that we hand out everywhere, so people have a phone number that's easily accessible. Most of the time, they will just call and they will start setting up a ride. But we have volunteers who take applications at our senior centers. We do have a senior services and public transit advisory board that meets on a monthly basis, and so there's an opportunity for people to come to that public forum and express what their needs are. That is the board where we go and talk to about expanding services. We've done surveys, so lots of opportunities for people to come and tell us what they need. But the entry point into services is very simple. You don't have to go online and fill out an application. If you come into our senior center, somebody can help you fill out an application, and then you get really direct communication with an individual.
The second part of my question is, how have you been affected by the increase in gas prices?
Well, we have limited funding, and so it's really causing us to really look at our budget and manage it very closely, which is something that we do anyway. But as of right now, we are on track with the number of rides that we have based on our funding. But I anticipate at some point we're going to have to get pretty creative on how we're coordinating all of our rides to make sure that our fuel budget can last us through our grant cycle. So we have a mixture of gas and diesel vehicles. And so that might, depending on gas prices and what the need is, we might shift the vehicles that we're using for the transportation that we're doing, just to make sure that we're being conservative and thoughtful of our resources.
I'm asking that question because we're in the summer months, but in the winter months, it's going to become more difficult. The last question that I have is, how do the buses handle inclement weather?
So we have, some of our vans are all-wheel drive. All of our buses have drop chains, and so we're not having staff that's out there trying to put chains on the wheels. They all have drop chains. If inclement weather is unsafe, We don't send our drivers out. We really try to coordinate, to reschedule appointments. But we really just look at it on a day-by-day basis and what the weather is and whether or not what we have on our schedule can be moved. And so, but our buses are equipped either all-wheel drive or drop chains. And so we make sure that we purchase vehicles that can handle weather.
And you have a communications means to notify the residents if the buses are not running?
Yeah, right now, our dispatcher calls people individually. We have explored different apps that we've looked at, but funding is limited. But we have looked at some different apps where we can communicate out to people, because it's not just transportation, it's our meals, it's our homemaker, it's other services that we provide that we would like to be able to mass communicate with people to say, hey, this service is canceled in this location due to weather. We use social media. We have our public information officer who will put stuff out. But a lot of times the things that work best are we get on the phone and we call people individually.
Thank you so much. Again, I want to say that this has really been a wonderful, comprehensive presentation, and I thank you very much for it. Are there any questions from the forum members?
Quick question.
You're recognized.
Yeah, Fred Silberkraus, Senate District 5. Very impressive list of community services. I had a very minor question on 2 points. You talk about one of your services being animal services. Is that in the form of a shelter?
Yes, so they do 2 things. They do emergency impounds, and then we have an adoption program too. So they do both.
Do you know whether or not the shelter or there are any provisions in Douglas County for what they call TNR programs?
Yes, we do. We have a TNR program.
The shelter does that?
We work with a nonprofit organization called Douglas Animal Welfare Group. And so it's a partnership that, but it's mostly the nonprofit that does it, but we work closely with them.
I'm delighted to hear that. Something on a really minor topic, you mentioned weed control. Is that for public lands or private lands or both?
It's for both. And so we do it in a couple ways where we have staff that will go out and spray. Our focus really is to protect our agricultural lands. And so we do focus a lot on our ranches and our ag properties. We do rent equipment for residents to be able to spray their own properties. Residents can schedule our staff to come out and spray, but our staff's really main focus is protecting our alfalfa fields and our ranch lands and making sure that they're free from noxious weeds.
Would that include all of the highways and roadways?
Yep. So we do. Yeah, we do have a contract. Sorry.
Yeah, I know. I was just curious about. I know here in Las Vegas we have a terrible problem this year with weeds and NDOT, I assume.
Yeah, so we do have a contract with NDOT. We have a contract with NDOT where we will spray the roadways along the highway and stuff like that too. So yes.
Excellent. Thank you very much.
Thank you for that question. Ms. McAdoo?
Thank you, Madam Chair. This is Kathy McAdoo. And it really is not a question, but living in District 19 and rural county, Elko County, I heard you talk about the expense for CDL licensing and how you have a decline in those. And having been a former regent for the Nevada System of Higher Education, I am very aware that Western Nevada College, as well as Great Basin College here, offer those CDL license classes. And I know in rural counties, we're very much about partnerships. So I just wanted to suggest that maybe you could get with President Dalpe and see if there was a way you could have a partnership there to help increase the CDL licensing. It's just a comment, a thought that is going through my head.
Yeah, thank you. I appreciate that.
Thank you for your services.
Thank you, Ms. McAdoo. We appreciate that question. Are there any other questions? Mr. Fallmeyer is recognized.
I am just amazed at the comprehensiveness of the programs that you're managing. And I guess my question would be, is there any similar type of program in the urban area that you're aware of?
Not that I'm aware of. No, I guess not. I think a lot of communities that we visit, you have parks and recreation, which are very separate from senior services, that are also separate from transportation services. You might see some areas where your social services, senior services are more combined, but I have not come in contact with a community, and I attend a lot of national conferences too, and I see this, you know, across the country. I don't see a lot of systems that are set up the way that Douglas County has set up the community services department. It's pretty unique.
Madam Chair.
Thank you so very much. We really appreciate your presentation. And if there's any follow-up or information that you would like to share, please get back to us. Have a great morning.
Madam Chair.
Oh, yeah.
This
McAdoo.
Kathy McAdoo. Yes. So in regard to the question the gentleman just asked you about, as a former executive director of a coalition, and we have coalitions in all 17 counties in Nevada. And I know that Cheryl Brooker there in Douglas County did such a great job, and I believe you still have a strong coalition. But I would say for your metropolitan areas, there are coalitions there, and that would be the place to ask the question where those coordinated efforts are, I believe, in every community. Every county has that offer, and that's part of the role, is connecting resources to gaps and gaps to resources.
Yep.
Thank you.
Thank you so much. Again, Ms. Addy, thank you.
Thank you.
We will now address agenda item 6, the overview of the volunteer transportation program administered by the Nevada Rural Communities Retired and Senior Volunteer Programs, and consideration for transportation access and affordability for seniors in frontier and rural Nevada areas. And our presentation will be presented by Molly Walt. Ms. Walt, we will now hear from you. Please know that we're having a few technical problems, and so I think we are almost finished and ready to go.
Good morning. My name is Molly Walt, CEO of Nevada Rural County's RSVP program, which is Retired Senior Volunteer Program. The RSVP is an AmeriCorps, so we are part of an AmeriCorps grant. So that is our largest federal grant. I'm here to present to you about our transportation program, and we do touch upon all 15 rural counties strategically, and so we'll go ahead and start with that. So thank you for having me. and giving me the opportunity to tell you the great things that Nevada Rural Counties RSVP is doing. So this will be an overview of our senior transportation program, the barriers, the senior guidelines, referrals, and some legislative concepts as well. Like I mentioned, we do service all 15 rural counties. Depending on the county, really kind of depends on how many programs we do offer within that county. In order to receive our services, you do need to be a client. So we have a client application process with that. The eligibility is 60 plus or an adult with a verified disability, 18 to 59. Our transportation and companionship program is door to door. What makes us a little bit unique from other transportation programs is that we can cross the threshold into the home of the client and assist them elbow to wrist to get out of their home and into our vehicles. Oops. So who are we? We are a volunteer power independent living service across Nevada, rural and frontier Nevada. We rely on volunteers. We do have some paid drivers that are paid through our NDOT grant. So we do receive, we are 86% grant funded. We get quite a bit of money from grants from NDOT, and then also Aging and Disability Services is our largest state funding and funds through Healthy Nevada. So our mission is to provide life-saving volunteer programs that help seniors and people with disabilities maintain their independence with dignity. We have several different programs. Transportation is one. Transportation for us is two-facet. We have 19 fleet vehicles that are strategically placed throughout the state of Nevada, but then we also have a personal vehicle program where drivers can use their personal vehicles, and then they get a mileage reimbursement that stays with the GPS or with GSA rate. We also have a respite care program. This is where we provide a respite care provider that goes into the home and gives the caregiver a break. The caregiver does have to be a 24/7 caregiver. So they would be somebody that is with them 24 hours a day, 7 days a week. And then the respite provider will go in and give them up to a 4 to 6 hour break per week. We have our personal emergency response system. This is very popular. What we do is we provide a I've fallen and I can't get up button free to our seniors and to our adults with disabilities as well. We also then have what is called a lifeline program that does cost $60 per month. Both units detect a fall. However, the lifeline will call the top 3 people on their list before calling 911 to give the emergency contact a chance to talk with the client. Then if the emergency contact says then call 911, then it does. The free unit detects a fall, but the senior does have to speak. They have to be able to speak and give their name and their address. So some will start with the free unit, which again is, we're able to do that through an ADSD grant. They will start with that and then maybe graduate to the lifeline, depending on their confidence level. We also have what's called our Nevada Golden Connections telephone reassurance. This started for us, it was the NEST program that was just, started through UNR. And then they had asked, it's Nevada Ensures Safety Together. And then they had asked if we would be able to provide the direct service. And so, which we did. So what this is we have volunteers throughout the state of Nevada. So we might have a volunteer in Las Vegas calling somebody in Winnemucca. We actually do. So I'm not going to say we might, we actually do. And they then, the conversations might last 5 minutes. They might last an hour and a half, depending on the client and the volunteer. But we do have a couple volunteers in Henderson calling Tonopah, or they call Ely, clients of ours in Ely's. The conversation, all of our volunteers are trained. The conversation is Just, how are you doing? We talk about the weather. We talk about hobbies in which the clients like as well. And then the volunteer, we have weekly huddle groups with staff. Those volunteers then go into the huddle group with staff, talk about any concerns that they might have about the clients or any other assistance that we might be able to provide. If there is an emergency, the volunteer, because all of our volunteers and employees are mandated reporters, they would then call the Carson City office right away, and we would then either send the Sheriff's Office MOS team to the house or contact ADSD or even make an APS report. We also run a homemaker program. So we do the same as you had heard Douglas County does as well. So we provide homemakers that go into the homes of our seniors and provide light housekeeping. And again, every program, I want to emphasize, every program that we offer, we really emphasize on companionship. So we are not, and the one that comes to me, we're not a maid service like Molly Maids or something that goes in and cleans the home and leave. All of our volunteers, all of our homemakers, respite providers, or drivers are trained to provide that companionship, to get to know the client and recognize when something may be off with that client. And so then that keeps in track our activity timesheet that all of our homemakers and our respite providers and drivers have to complete, have a little comment section at the end that says, did you see anything out of the ordinary? How is the client doing? Is there any other resources that we might be able to help the client with? And it just keeps tabs. What we will then do as a staff is randomly select some of those timesheets, activity cards is which we may call them as well, and call the clients and just kind of do a check-in. And all of our services, again, like I said, are grant funded, which then has grant specifications that we must do. So for example, our homemaker program, the grant specification is we do a 3-month call, a 6-month home visit, check-in, and then a 12-month as well. And it's not just checking on the work that the homemaker or the respite provider may be doing, it's also checking in on the client to making sure all of our programs. So respite, we do a 30, 60, 90-day call and then a 12-month annual visit. Homemaker, we do a 3-month call, 6-month home visit, 12-month home visit. But then any other grant we do, at minimum, we do an annual home visit that we go into the senior's home. Our senior companion program is volunteers that will go into the home, provide companionship. They may watch movies, play cards, play games. Some clients just say, just come in and check and then leave. They may not want that visitation, but it is offered to them as well. And then we also have our volunteer station program. This is our AmeriCorps program. We partner with nonprofits and government entities because RSVP for AmeriCorps is the more active you are, the younger you will stay. And so we ask that for our volunteers that are 55 and above, we will put them into a volunteer station to volunteer, whether it be libraries, sheriff's offices, gift shops at a hospital. Our largest volunteer station is actually the Nye County Sheriff's Office, where they will work the events, down in Nye County, whether it be Tonopah or Pahrump. Our other large one is our War Veterans Memorial. These are volunteers that drive throughout the state of Nevada to make sure that our veterans are getting the memorial service in which they deserve. And so what we do then is we're able to give them a mileage reimbursement from the start of their home to the volunteer station and back again. And so that's our volunteer stations program. Whoops, wrong way. Also, I wanted to mention that we do approximately service 110,000 square miles throughout the state. And we do have a centralized location, which is Carson City. So Carson City is what I call our hub office. That is where all of the transportation scheduling happens and dispatching throughout the state of Nevada. But we do have an office in Winnemucca, Elko, Ely, Caliente, Fallon, Tonopah, Hawthorne, and Pahrump. Everywhere we have an office is where we have fleet vehicles. We do have a fleet vehicle that is stationed in Douglas County, but we do not have an office there. We felt that we could take that part-time employee and move them into the Carson City office because Douglas County is so close to Carson. So we're able to accommodate that. We are fortunate though to partner with the Douglas County Sheriff's Office so we can park our fleet vehicle at one of his buildings, and then we have the key there as well that is accessible for the driver. So the driver would, we have 2 Douglas County drivers. They would go be able to get the vehicle and take from that location as well. Our transportation model is we do an intake and eligibility. So we, client or a senior would submit a client application. Like I said, the eligibility is 60 plus. Or an adult with a verified disability. We process the application within 24 to 48 hours. They are then called in a welcome phone call to then go over any other programs that they said. Our most popular is our transportation program. And so if they just, checked the box for transportation, we would then explain to them all of the other programs that we offer and see if they might be interested in those, and then go over the eligibility with that as well. They then, at that point, are sent the transportation guidelines for that county. Every county has transportation guidelines, in which I'll go into a little bit more in depth. At that point, they're eligible. They can start calling for transportation at that point. We then try to get in within 2 to 3 months to do a home visit, but we are not stopping them from getting transportation and scheduling transportation in order for us to go in and do a home visit. The home visit, again, is not an assessment. It really is just to go in, check in. We like to know our clients, and we go in and provide that home visit to let them know what other, services that we might be able to offer them as well. And then we do report back to our grantors if there's something that might be of concern. We report that back to our grantors, which, like I said, is our largest grantor is ADSD. The trips are then coordinated to medical appointments and nutrition. That's when they call us for transportation. That's what gets them out the door. It has to be a medical appointment or it has to be a nutrition. And then when they're out the door, they can have then 2 additional stops. So if they have a doctor's appointment, we'll always say, when is what date is your appointment, what time, and then would you like an additional stop? That additional stop might be a post office, it might be a senior center, it might be a bank, it might be the Social Security office. It varies really depending on where they're at. Most often, we do not go from Ely to Salt Lake without every client making additional stops. And so they'll go to a specialized medical appointment, and then they'll go to Costco. Costco or Walmart are the most popular because it is Ely or Lund or McGill. And so they are taking advantage of that nutrition stop. We also dialysis. Most of our counties, we only can provide 1 transportation request a week. Humboldt, we do 2. Elko, we do 2. So the more rural, we do 2 requests per week. However, if it is dialysis, we will try to make that accommodation for 3 rides per week for that dialysis client of ours. Assisted transportation. So like I mentioned, we are door to door, but we also can cross that threshold to go into the home and help that senior or adult with disability elbow to wrist outside. We also then do provide wheelchair. So we do have wheelchair vehicles in all of the places in which I mentioned we have offices. So in Carson City, we have 2 wheelchair available vehicles, fleet vehicles, and then we have 2 non. But with NDOT, you cannot have a non-wheeled paratransit vehicle without having a paratransit available. And so we were fortunate enough through an NDOT grant to get 4 SUVs. And then through an ADSD grant, we were able to get 1 as well. So we have 5 SUVs, Toyota hybrids, which has helped us. I know the questions came out about fuel. I'm telling you, they have helped us dramatically because they are placed in rural communities where we do a lot of long distance. So we have an SUV in Ely that, like I said, transports to Salt Lake once a week, St. George once a week, and Las Vegas area twice a month. And so if we do not have a paratransit client, then we will be taking that hybrid, and that has helped us out a lot. The other reason that we requested the SUV is because it sits up a little bit higher. And what we found in our rural and frontier communities is that the lower the gravel roads were really taking a toll on the bottom of our vans, of our paratransit vans. And so where you have that little step to get in, most of our vans no longer have that because of the toll of the gravel that it did. So we asked for a little bit higher of a vehicle for that as well. And so we are fortunate to have those in some of our communities as well. And it has expanded our transportation in Nye County. So in Nye County, we traditionally only had 1 vehicle in Pahrump, but we were able to expand and put a vehicle in Tonopah. So that was extremely fortunate as well. So we thank our grantor NDOT for that as well. All of our trips are very well documented per our grantors. And so we document the miles from start to finish, the hours, the purpose of the trip, the amount of exits that we take as well are documented. And then again, any concerns that we have as well. We then do have a GPS system and a camera in all of our fleet vehicles. And then in our personal vehicles, it's all through our database and our scheduling system that will go from the volunteer's home to the client's home and back, and then it will take the mileage to the medical appointment or the nutrition, the amount of stops back again, and then that's how we can verify their mileage for the mileage reimbursement through that as well. Just a little bit about what we have done in 2025. We did a lot for our transportation. Keep in mind, these are just transportation hours and miles as well. The total hours served by our volunteers, and like I did say that through an NDOT grant, we do have some paid drivers, was 46,936 hours. The average volunteer is giving us 265 hours of their time. We were able to, this is program, I mean, this is organizational wide, but we were able to service 697 clients with 177 active volunteers. For the transportation part of our program, we traveled, and this is personal vehicle and fleet, 224,694 miles. Drivers in their personal vehicles drove 87,457 miles, and in the fleet vehicles, 137,237 miles on that. So where are there gaps? Some of the gaps that we see, because we do get referrals from county entities, such as Jump Around Carson City, White Pine, Get My Ride, DART, which is the Douglas County that just presented as well. Some of the gaps are crossing that county line, and we're able to do that. So we're able to start, you know, at the one of the sheriff's offices buildings in Douglas County and bring them over to Carson or to Reno as well. Guaranteed we do on certain days only. We don't do it any day, but the guidelines are shared with our clients so they know those days as well. And as we said, we go from Ely, because Ely does not, White Pine does not cross county lines, nor do they go on unpaved roads. And so we're able to do that. So you can imagine our vans were really getting beat up in the White Pine area. So we were able to, like I said, we're able to go to the Salt Lake area and St. George and Las Vegas. Humboldt, we go to from Winnemucca area to, we'll pick up in Lander and go to Reno once a week. We did have to even change one of our vehicles. So we have 2 Ford Transits that can accommodate more passengers. We had to relocate one of those Ford Transits that was not being utilized to the capacity from one county, move it over into Humboldt County, because he will have that vehicle full of 7 clients every Tuesday going to the Reno area for, like I said, doctor's appointments, and then they will do nutrition at that point as well. You know, a gap is the specialty care, the distance, because there really isn't a lot of specialty care in rural Nevada or frontier. So we are transporting to Reno, Las Vegas, Salt Lake, St. George. Twin Falls has become very popular for our Elko community. I know, going to Twin Falls. So they would, some of our clients would rather go to Twin Falls, Idaho, rather than Salt Lake. And so that is one destination that we have added in the last year and a half. The one thing that we are finding a huge gap is when our clients are having a procedure and they need signed out. So they have cataracts and it is a procedure. They go under anesthesia and they need somebody to sign them out. We can't do that. And so it is a problem. And we honestly do not know how to address it. So for example, we have a client who needs a procedure from Winnemucca in Elko. He is very distressed at this point because he needs somebody to sign him out. Our driver cannot do that. So what we've tried to do to accommodate is we have an escort. So that escort does not need to be 60 or above. They just need to be 18 years or older. So if they can go find a neighbor that could be an escort, then they become a client as an escort only, and then they can go with the client to the procedure and be the one who signs them out. We've also asked doctors' offices if there's a possibility that their social workers might be able to help them do this, because I'm telling you, this is a problem when you are a senior and you have no one. The short notice rescheduling is a gap that we see as well. So our guidelines are, for some of our communities, we need 5 days advance notice. For Carson City, we need 7 days advance notice because we have to be able to go out and dispatch. We don't have drivers just sitting in the office waiting for a ride. So we need that advance notice. Well, when a doctor cancels and says, well, we can see you tomorrow, that makes it really hard for us to accommodate, especially if they are traveling from Ely to Salt Lake. We only go on the first and second Monday and the third and fourth Thursday. We found that we had to change that up a little bit because doctors were starting to take Mondays off. And so some clients have their doctors don't work on Thursdays, but they work on Mondays. So we kind of switched it up a little bit. Our transportation guidelines, they switch at the need of the clients. Okay, so we are able to try to do that as well. But it's very hard then when their doctor in Salt Lake cancels and says, but I can see you tomorrow. We do have exceptions, and if our vehicles are not being used and if our driver is available, we will definitely try to make that exception and make that appointment. But what we do then is we do call the doctor's office and let them know this is really hard for us. If you could, work with them a little bit, it would be appreciated because it's hard on all of us as well. So that is a gap as well. So we do our rural trip guidelines, our transportation guidelines. Like I said, we do try to accommodate the client, but we try not to change our transportation guidelines every month, because then that is sending them out to the client saying, here's this, but we do try to accommodate. So we do have exceptions as well. And then the advance notice, it is a gap. our clients would like to be able to say, I need a ride, it's 9 in the morning and I need a ride at 2 p.m. We're not able to accommodate that. For emergencies, we will. For example, we had an emergency last week that our client canceled their appointment. Our driver came in that morning and said, I'm very, very concerned about this client. She did not sound well at all. And she canceled her doctor's appointment, but I still think there's something more that we can do. We called the client, asked, why are you canceling? She says, I'm not feeling well. Should we be calling 911? I can't call 911. They will not lock my door, nor will they make sure that my pets are taken care of. So we said, fine. We'll make that exception. We'll pick you up. We'll take you to the ER. We will have one of our volunteers make sure that your pets are okay. It's been a week because she is a reoccurring ride. And we called her this morning and, I asked her how she was doing, and she's still in the hospital, but her pets are being taken care of. Many of our seniors are very, very lonely, and their pets are extremely, extremely important. Why I get emotional is she was willing to not get the medical service she needed in order to save her pet. So the transportation challenges for our seniors, like I said, they're no longer driving. They no longer have, they have limited family or caregiver support. Some procedures, like I mentioned, they have to have somebody who signs them out. The doctor's canceling and wanting them to come the next day. The long distance trips mean an entire day. That is hard. So our Humboldt clients, our Winnemucca clients, our, White Pine, Lincoln County, Elko, when they're going to long distance, it's a full day because it's not us just driving them, one client, and coming back. It is multiple. So for example, our Winnemucca transport, you might be a client that has an appointment in Sparks at 11, but then we have somebody who has an appointment at 10 in South Reno. The client in Sparks gets dropped off early. So then the client in South Reno can get to their ride. And then he will go back and forth. But our clients know that one, they're in a doctor's office that has a restroom. We ask them to make sure that they pack water and snacks or lunch. The doctor's offices normally, their climate environment are okay for our clients as well. We do ask them to bring a sweater though in the summer months with the air conditioning as well. And then they will stop and have a lunch. And so that does count as an exit, as a nutrition exit, but they will stop and have a lunch as well before going home. Our White Pine, we see that within our GPS system that they are stopping at least 3 times for a restroom break, for each of those rides as well. It makes for a very, very long day for our seniors as well. And so I guess the challenge is not having those specialty doctors in those counties, being able to be set up there as well. This is just not. All right. Our guidelines, like I said, I touched on this a little bit as well. And we do need to have an advance notice. And some of the counties, it's 5 days, some it's 7. We do only go to urban areas on certain days. And, some will go once a month or once a week. Some will go every other week, depending on the urban area in which it is. The same day or non-day requests, we will allow an exception if it's an emergency, but most of the time we are not able to accommodate. And then it is the procedure discharge limitations that our clients have. Who do we get our referrals from? We get 35% of our referrals from hospitals and home or healthcare systems like home health agencies. We also get 25% of our referrals come from county and local transportation providers. That meaning whether it be DART, Jack, Get My Ride, CART in Churchill, Mineral County, the counties as well. We do get 15% of our referrals come from ADSD social workers as well, social services, veterans organizations, and then just referrals from senior centers or they just heard about us from a neighbor. And so what works for us, which legislation works for us, is NRS 706.745. This is for nonprofit entities. And so this legislation works for us. What I would like to be able to see improved is the fact that, and I don't know how you do it, but it would be great if there was something that you could do to help our clients not necessarily need a procedure sign out. Like I said, we do offer escorts, but you would be, I think you would be really amazed at how many seniors have nobody. And that's the problem. They have nobody. We will have some volunteers. I know like in White Pine, we do have a volunteer. She volunteers to escort. That's what she does. And so she will escort our clients to, these specialty appointments, because our drivers cannot assist our seniors in a restroom. They can't. They can't go in it with them. A lot of our seniors need some assistance in that area as well. So we do have a volunteer that's what she does. She is an escort. We are definitely seeking more volunteers for that purpose on that end, so they can help our seniors with this transportation. Another thing that we started as well is, and Dart mentioned this as well, through SB 118 funding. We were fortunate to get that through the Carson City Health and Human Services. So what that did then is it helped us facilitate a monthly Quad County Community Health Improvement Plan, which I facilitate those monthly meetings. This includes Douglas, Lyon, Carson City, and Story County. And we get together to try to find that coordination. For Lyon County, they will cross the county lines, but they could use more of it. So we meet to see what coordination is needed. We're also working, this committee that we started also has sent letters out to doctors, because we can't get past what I call that gatekeeper, the one who makes that appointment for you. Their mail, they go through the mail. When I walk in the door, they stop me. They will not let me in the back, but we need to get to those doctors to be able to emphasize the importance of coordinating the medical appointments with our seniors and the transportation entities that provide that transportation. We need to be able to get in to be able to see them and discuss the importance with that. Another thing that I would like to see improved, that as a suggestion, is sustainable funding. All of us, I believe, that I've presented, we go after grants. We're 86% grant funding. It's a competitive cycle, which I think ADSD will probably address. It's a competitive cycle every 2 years. So your question is always, can we sustain our program? If our funding does not increase or does not stay the same as we projected, are we going to be able to sustain the programs in which we offer? So sustainable funding would be great legislation in my mind. And then, we do volunteer recruitments quarterly in all of our areas. We do appreciation for retention, but it would be great if there was some legislation that actually would encourage people to volunteer. So I developed some concepts of what might be something that you would be interested in to help this transportation, that the importance of the transportation. So the sustainable funding, in which I met with the rural and frontier transportation funding formula, might be something that interests you as well. The volunteer driver incentive program, this might establish incentives to recruit and retain volunteer drivers. We are fortunate, we do. we are fortunate to have the volunteers that we have. We pull at the heartstrings is what we do. And we ask all of our volunteers, you know, they have to have service in the heart. But we go, we do volunteer recruitment events, and we go where they are. We have been extremely creative, but we are trying very, you know, hard to get them. But if they were able to get recognized at a state level, I think it would be huge. You know, pins, you know, certificates, any which way that you might be able to recognize them, have a volunteer day that might be able, I would really work to get them there to be recognized during a legislative session. I think that would speak volumes. The medical escort assistance program, we went for a grant years ago with AmeriCorps. We did not get that grant, but what we were trying for as well is to have that medical escort and then have that person to be able to go into the doctor's appointments with them and help them. And then the healthcare coordination as well. And why all this matters, I think you all know, but it matters because our seniors, they are, we need to keep them out of independent or living facilities. It would save the state, as well as I'm sure many of our seniors don't want to be in those facilities. They would rather age in place. I think that is extremely important. It reduces the caregiver burden and the family stress. And, you know, like I said, it could save the taxpayer dollars as well. I say this in all of the presentations in which I do that, but our seniors are the forgotten generation, out of sight, out of mind. And so we are an organization that tries to bring that to the eyes of our community. You know, aging is a circle of life. And so if I say, you know, we wouldn't allow a 5-year-old to stand on a ladder and change a light bulb, so why would we allow an 86-year-old? Society needs to recognize that. They need to recognize that we put a lot of funding and a lot of services into our youth. And keep in mind, I have no problem with that. I am on the school board at Carson City, so I am very, you know, much of a youth advocate as well. But we do not put that emphasis on our seniors. And that needs to be a societal change. Thank you. So thank you very much again for giving me the opportunity to present. And do you have any questions?
Thank you so much. You have given us a lot to think about. Clearly,
yes.
Being a senior has its problems.
Mm-hmm.
For our members, do we have any questions?
Yes, I do.
Mr. Slaughter's recognized.
Well, I see there's a lot of counties that are closer to other states than that. I guess Nevada is on 5 different states: Arizona, Utah, Oregon, so California. Mm-hmm. And you got more. I mean, you got, how would I say, residents that are closer to Idaho than they are closer to services here. And I saw that when some of your clients want to go up to Twin Falls or something like that. And the other thing is, I'll just say real quick, is as the population gets older and it's growing, the next generation, how do you plan for what's coming down the pipeline as far as the next generation after this generation is serviced?
You know, we do, and so we try to incorporate the younger generation into the volunteerism. You know, I know with AmeriCorps it's 55 plus, but we do have volunteers. We try to get our schools involved. Like when we have fundraising efforts in Elko or, you know, Pahrump, Tonopah, Fallon, we reach out to the high schools and we invite them in to come in, and whether they we had the choir, we had the band, you know, and they provide the entertainment, but then they also help us serve. And the participants at those fundraisers are seniors. We take that opportunity to one, encourage volunteerism because it is at a decline. Our younger generation is not being taught that volunteerism and giving back to your community is extremely important. So we take that opportunity to try to teach it as a teachable moment to get more volunteers as well on that end. But then we also, with our telephone reassurance, we that's where we recruit the younger generation to call our older population, and it's life learning, you know, for both. And so we're just trying to be creative is what we're trying to do. We get, like last year, we got 562 new applicants. And with that, though, they may not necessarily need our program right then and there, you know, but they want that application on file. So when they do need it, they're ready to go. And so we're nonstop working at trying to educate our communities.
Well, I can tell you the next generation, as I work with kids myself, kids with addictions and stuff like that, I do a lot of stuff. But anyways, they're going to be more lonely than this generation coming up. And there's going to be more of them because of, you know, iPhones, screen time. And I'm trying to help with a situation myself with that. And last but not least, it's very important to recognize those people that come out and, you know, volunteer, give their time, their passion to programs like this. And I would just think maybe a tax exemption on registering their car, or a tax exemption on the house, besides the recognition of a certificate, those kind of things. So people know that they are important when they do come out and help out. That's it.
Yeah, and I appreciate that comment, and thank you for your question. It was an idea I had, but I didn't want to be the one saying, you know, funds that go to help our state, because I know that our aging ADSD, you know, needs more funding. And so if I'm going to come up and say, give them a tax exemption, but then I'm asking ADSD for more funding because the services are more at need, then I think that might be a little bit hypocritical.
Lastly, the services they provide will, you know, outstrip the taxes that we lose by giving them an exemption, big time.
I would definitely appreciate that. I think it is something to that magnitude would be very encouraging for others to volunteer.
Madam Chair.
Chair recognizes Mrs. Buongiorno.
Joanne Buongiorno, Senate District 10. I'm very interested in your sign-out procedure. I don't know what the criteria is to sign anybody out, but today with AI, we have things like voice recognition. Couldn't something like that be used, his own voice in recognition, to be able to sign out?
That I would, and thank you for the question, but that I wouldn't have an answer to, because like I said, we can't get past that gatekeeper in that doctor's office. You know, we've written letters, we'll call and say, is there any way that you can help us with this? But we cannot get past the person who answers the phone, which is like your scheduling. And I've sent out several letters to the same, you know, medical groups and have not received any response from any physician.
Well, how do they sign out then?
So it's just like if you were to go in, you would have to have, you know, a family member or somebody sign you out if you went under anesthesia, and they would be the one who takes responsibility for you.
Well, then what happens if they can't sign out?
What
do you do?
We try to find them an escort. And then we...
Is this a legal thing?
Yes, from your physician's offices, yes. And so we do try to find them an escort, but we can't have our driver being the one who signs them out, because the driver is busy driving them home and will not be able to give them the attention that they need. And so we do try to find escorts.
Am I understanding this correctly, that the individual could sign himself out?
Not necessarily if they're put under anesthesia, no.
Thank you.
Yeah.
The chair recognizes Ms. Levitt.
Thank you. I really appreciate your presentation and the services that you offer. This was very thorough, and I do some volunteer work also I'm a senior, but I do volunteer work in the senior center in Boulder City. And you're so right that there are many people who don't have anyone they don't have a support system. And so I understand this, it just seems like such a simple thing, but it isn't simple in requiring this medical escort. So my question is this something that we can do? This requires legislation to change the law so that I don't know. I'm trying to understand how we can help with this. Is this if it's illegal? And I understand because I had cataract surgery myself. I had to have somebody there with me who would sign me out. And so I'm trying to understand how we can help you resolve this problem.
Well, thank you, and thank you for your comments, and thank you for the question. I do believe that it would be something that you would need to consult with the physician's board, is where I would.
Madam Chair.
Chair recognizes Mr. Philcroft.
Yes, Fred Silverkraus, District 5. Just an aside, on a personal note, I did find out that not even a Uber driver, if you were to hire someone, an individual, can legally sign you out. Has to be a individual that accepts personal responsibility for the patient. It could be a neighbor, it could be a relative, but you can't even hire someone to do that for you.
Correct. And if you, may I?
No, I just had another question, but if Mr. Silvercrest, is that your question, Mr. Silver? You're finished? Okay. In reviewing your material, I see that you're a 5013C, which is donation. How effective has donations been to support what you're doing?
So with the economy, our donations have seen a decrease, a large decrease. We are donation based. We have suggested donations that is mandated by, our grantor as well, which would be NDOT. So we do have to say, but we do not decline if a donation isn't there at all. But our donations have, so we have strengthened our fundraising efforts, our grant writing to foundations. We have done different campaigns, sponsor a ride. If you would be, for our homemaker service, we had a homemaker campaign that would then, it's like sponsor a client to provide homemaker services for 6 months or a year. And then we provide that sponsor with stories on that client. So we have been, I would believe that we've been very creative, but we do fundraise a lot, and but we do not decline if one is.
Do you have an organizational strategic plan?
Yes, we do.
Do you have perhaps one of the things that you might want to consider is having one of the goals is to have a giving program wrapped around the 5013C so that you can have greater outreach, because I see that you have a clear need for this, but that has to come from within.
Right. And yes, and thank you for the comment. And so we do have our campaigns. It would be giving, I call it a campaign, and that's where, and it is on our website, that you can sponsor. And so it is our giving campaign.
Right, because this is very important, and part of that plan could be accountability and sustainability over time, and do it in a 3-year to 5-year program so that you can constantly look to see how the costs are increasing and how you can upgrade your program. This is just a suggestion, but I think that might help.
No, I do appreciate that, and appreciate your comments. We have been fortunate to be established for 54 years. And so with that, I think comes accountability, it comes reputation. And so when we do have a need, you know, we're able to go to our community partners and really kind of, you know, let them know that, hey, this is our need. It was, we did our first fundraiser in Elko at the senior center, and I was taken back by the amount of support that we received, and in Pahrump as well. When you give it a reason, like we are fundraising for this reason, your sponsorship, your donation, your attendance to this event will help X, Y, and Z. And we found that to be very successful.
Thank you so much. Are there any other questions? The chair recognizes Ms. McAdoo.
Thank you. Thank you, Madam Chair. Hi, Molly. This is Kathy McAdoo in Elko. And I don't know about the other rural counties because I'm not in those much anymore. However, I know in Elko County, we have at least the last 5 years where I've been really directly associated with RSVP in our county. It appears to me that an issue that has to be on the forefront for you is keeping a director or whatever their title is here in the county. Because I know as of today, we no longer will have a director again. And in the last, I would say 4 years, I think we've had 4, but we go a period of time without them. So is that just a rural county situation or simply an Elko County situation? I'm just concerned about here. We don't,
right.
You know more about it than I do, but I'm just observing and watching the people come in and out of the senior center
right.
for RSVP services.
Yes, thank you for the question, and you are correct. We are extremely saddened that Gina has I know that she has decided to take the year off so she can be with her son during his senior year, which is hard. But no, we do not have in Elk, like in Ely, our service coordinator has been there for 7 years. We don't see a lot of leaving. Elko has had, the transition as well, but if we had funding for full-time positions, that's what we would, that offers benefits, but we do not have the funding, for that. So our field offices are staffed with part-time employees, and that seems to be why we are unable to keep somebody at a longer duration. So if we did have the funding for full-time, but we just don't. If we took the funding for full-time and added benefits, we would have to cut our services. Mm-hmm. Yeah. And so, but do know though, we have interviewed 3 people. We do believe that one would be a great fit. And so, but again, it is somebody who is part-time, wants that flexible schedule so they could stay home, work while their kids are at school. So.
I mean, you made the comment, the decline in volunteerism. And I think that transfers over maybe to, I realize the director isn't volunteer, but no benefits and all those things that come across the board with nonprofit work. It's a struggle. So thank you. I appreciate it.
Yep. Thank you for your question.
Thank you, Ms. McAdoo. We appreciate the question. It's been a pleasure hearing from you this morning, and we see that your passion and your interest have made us all really want to consider exactly how we might be able to help. Thank you so much, and please keep in touch with us and let us know what next steps we can take. For members, we have been functioning for almost 3 straight hours. I think it's time for a little lunch break. So let us look and reconvene in another 30, 35 minutes. Thank you.
You. Oh, good. Haven't started yet.
We will now begin our afternoon session. Please note agenda item number 7, presentation of non-emergency medical transportation programs and non-medical transportation assistance services, successes, challenges, and policy considerations. We will have LaDonna Knighton, Ariana Ramos, Christine Columbe, and so we will now begin to our next agenda item. Thank you for joining us this afternoon. Sorry about the delay.
Good afternoon. Thank you for having us. And our colleague Kirsten is in Carson City. She will present towards the end of this presentation. My name is LaDonna Knighton, and I serve as the Chief of Community Services for the Office of Community Living within Nevada Aging and Disability Services Division, or ADSD. I will be presenting a short presentation on transportation options through the Office of Community Living's Community Services Program. ADSD utilizes multiple funding sources for subawards to community partners who provide reliable direct transportation or access to safe transportation services across the state. In state fiscal year 2025, over $2 million was subawarded to 29 community partners for transportation services. The funding sources included Older Americans Act Title IIIB funding, the Fund for Healthy Nevada Independent Living Grants Funds, and state funding for senior services. As mentioned in the previous presentation by Nevada RSVP, ADSD subawards to community partners for most of our services through a competitive notice of funding opportunity that is held every 2 years. Funding to our community partners is based upon the federal and state resources that ADSD receives. Community service transportation options are coordinated rides to help individuals get from one location to another with or without assistance. Community partners provide direct services or access to services through vouchers. Modes of transportation can include cars, SUVs, vans, buses for shared or private rides. Commercial vehicles or personal vehicles that meet safety, state, and other requirements can be used. Some vehicles are equipped to accommodate wheelchairs or other assistive devices. Transportation providers consist of paid staff and/or volunteers. Direct services include fixed route transportations to specific locations, as well as door-to-door service options. As shown on this slide, vouchers can be provided for bus passes, taxi coupons, or Uber Lyft rides. Thank you. So adults age 60 and over, or individuals with a disability, are eligible riders. They do have to be Nevada residents. Individuals contact the transportation providers directly. Contact information for the providers can be obtained through community outreach events from the providers' websites, bulletins, their community outreach efforts, social media posts. Also, individuals can access information about transportation providers through our Nevada 211 or the Nevada Care Connection Aging and Disability Resource Centers. They can also be referred by other organizations or professionals. Each transportation provider has their own set of rules for scheduling rides and as well as for limitations to those rides, such as the number of days in advance an individual has to call, the cancellation and no-show policies, or how many rides an individual can access. The voucher program sets specific rules for how often an individual can access a voucher. Sometimes they may get a weekly, monthly, or annual pass, and some have a set limit on the Uber and Lyft rides per month. Service limitations are usually based on available funding in order to prioritize the services and maximize the number of individuals that can be served. Older adults and individuals with disabilities can access community transportation programs for medical appointments, pharmacy pickups, nutrition access, such as ride to congregate meal settings, food pantries, grocery stores, even to attend daycare settings, seek employment, get to work, or for recreation socialization. In state fiscal year 2025, community services transportation providers reported serving over 5,000 unduplicated consumers. The Regional Transportation Commission of Southern Nevada, or RTC routes, funded through ADSD, reported serving over 10,000 duplicated consumers. The total number of one-way rides recorded in state fiscal year 2025 from community service transportation providers was more than 171,000. The unduplicated consumer numbers refers to the total number of unique individuals that access services. The duplicated consumers refers to the total count of every instance of service access. So regardless if it's the same individual and how many times they access services, regardless if they used it multiple times, it is the total count of access. Community service transportation providers for both direct services and voucher programs have reported wait lists. Not all providers report wait lists, but some do, and it's usually our voucher service providers. Rural providers also tend to develop wait lists, and in state fiscal year 2025, a total of 649 individuals were reported to be on wait lists throughout all of our transportation providers. Current service gaps and challenges in the community services transportation programs include limited transportation options in rural areas, as has been stated in previous presentations, especially for individuals who need travel across counties or across state lines. When available, the hours and access to those services can also be limited. Opportunities exist to improve coordination, not only between ADSD funded partners and organizations, but agencies and other organizations and resources that are funded through other programs. Federal and state funding constraints limit the ability of organizations to expand capacity, replace or upgrade their vehicles more frequently, or enhance program visibility and outreach efforts. To address these challenges, and with the purpose of reducing service gaps and improving service delivery, ADSD continues to explore ways to expand our partnerships, support coordination amongst organizations serving older adults and individuals with disabilities, and identifying funding opportunities for ADSD to diversify its funding, and also to support organizations in their efforts to diversify their funding sources. ADSD is also working in ways to increase agency outreach efforts to improve public awareness overall. And at this time, I am going to pass the presentation over to my colleague, Ariana Morales Ramos.
Hello, Hello, my name is Ariana Morales Ramos for the record. I am here to represent the Taxi Assistance Program. I am a manager also with the Office of Community Living. And today, yes, we are going to talk about the TAP program. It was created in 1995 to help meet the transportation needs of Nevada's older adults and persons with disabilities. This program provides discounted taxi fares to qualified individuals through coupon booklets that are accepted only by taxi cab companies in Clark County. Recipients use the coupon vouchers to go to the grocery store, medical appointments, and any other recreational activities of their choice. The funding is completely through the Nevada Taxi Cab Authority. It's through a surcharge on the taxi rides is how this is funded. The eligibility is for people age 60 and over or have a permanent disability. They live in Clark County, have a gross income below 125% federal poverty level, which is approximately about $1,662.50 currently. Recipients must re-enroll annually to confirm their ongoing eligibility. The TAP vouchers, TAP sells the taxi vouchers for $5 per book. Each book contains $20. A maximum of 7 voucher books are purchased per month. They are sold in $1 and $5 dimensions only. The way that the vouchers are used are they may be used as cash to pay for the cab fare. Vouchers can also be used towards giving the driver a tip. And you may take an additional passenger with you as long as you are both going to the same destination. So our current caseload and challenges. So TAP is actively serving 80 recipients who are on average purchasing about 575 voucher books per month currently. This declined from the 404 recipients that we were serving in November of 2025, and that is due to the reduced funding that we were receiving from the Taxi Authority. The program challenges that we currently are having rely on excess revenue collected by the Taxi Cab Authority above $200,000 to subsidize the transportation. Taxi Cab Authority revenues have continued to decline, resulting in an ongoing strain on the program. Increased administrative costs will reduce the number of recipients that we can serve in the future. So a great example of that is the paper cost of the vouchers continues to go up, and so that does affect the budget. We have met with the Taxi Cab Authority multiple times to identify new revenue options. Unfortunately, that has not produced viable results. ADSD does not have capacity to pursue additional funding sources for the taxi assistance program specifically. At this time, however, we do have a dedicated team of within our OCL staff who make sure that we are knowledgeable and aware of the other transportation options within Nevada. So when people call and they're looking for more transportation services, even though we currently cannot assist them with the services, we connect them to all the different resources that you're hearing today. So then that way they understand their other options other than us. All right, and I'm gonna, next slide. Do we have any questions?
Members of the forum, do we have questions? Chair recognizes Mr. Slaughter.
Frank Slaughter, District 11. With the funding that you're getting, you know, to implement this program, it does definitely looks like it's on the decline. Yes. And because we have Lyft and Uber, and not many people ride taxis anymore. Yeah. I still do, but my wife doesn't. My friends don't. They say you're old school. So how long? I mean, how viable is this program going to be in the future with declining revenues?
That's a great question. It's not looking bright from what you just stated. And I can just say that our team is doing the best they can and being very creative with being able to continue to serve the people we are. And we do have ideas and hopes for how do we continue to use this program in a way that still does meet the needs and is effective. You know, do we maybe go toward more a specific population that's transitioning from a nursing facility trying to get back home. So maybe being a little bit more specific about how we're using the funding, but at this point, we're taking it year by year.
And the last thing is, your taxis, are you upgrading them, you know, yearly, you know, to make sure they're comfortable, because you can get an Uber and you can get like a Volkswagen, you know, Rabbit or something like that. But the cabs, you know, they're big enough, they're, you know, comfortable enough, you know what I mean?
Yes.
Modern enough.
Yes, and that would definitely be a question for the taxi authority. We did invite them here today, but they had other commitments, so they weren't able to. Yeah.
Thank you, Mr. Slaughter. Are there any other questions? Maryland Jordan, District 9. You knew I was going to ask a question, didn't you?
Yeah.
And you knew I wasn't going to be happy with the question. How do you go from 80 to from 404 to 80 and still call yourself a program in Clark County? That's unbelievable. You're taking care of 80 people. I mean, that's like 2 days' salary for somebody that's actually working. So what's the story?
Yes, so we ended up deciding that the 80 people that we were going to continue to serve were the people that were our previous tier ones. They were the people that had the lowest income and didn't have as many options. And so we wanted to go ahead and see what we could do with the 80 people that we could serve this last fiscal year. I would say it was going to be reduced even more, but like I said, we were very strategic with how we spent every single dollar this year, and we were able to at least continue to serve the 80 people that we are. But exactly what you just said, it is a great question, which is why we're looking to how we're going to pivot that in the future to make sure that how are we going to continue and make this program effective.
What did you consider the symptoms of such a tremendous drop in a year? A tremendous loss. I mean, from 404 to 80, what was, what did you diagnose as the problem?
Well, the lack of funding. Is that what you're?
Yeah.
Yes.
That's totally lack of funding?
Yes. 100%.
And where was that funding coming from?
From the taxi authority.
And they just decided that they couldn't support you anymore?
Correct.
Did you have notice of this beforehand?
It was very short notice.
Okay.
Yeah.
So what's the prognosis for next year?
That's why we continue to meet with them to see how it's going to go. We actually did meet with them again within the last 2 weeks. At this point, they said that they are trying to work to see what they can do for us in the future, but they were not able to give us a definite answer.
Thank you. Smile, it's okay. I appreciate both of you being here, and I know it's hard to talk about this, but this is, for me, kind of devastating. I mean, being the size of our community and you're only handling 80 people, that's just unbelievable.
I feel the exact same way that you do, Madam Chair. And I also would just say we just focused on the 80 people that we are serving. It means a lot to them. And so that's where we really are just trying to focus on serving those.
Thank you so much for being here. And this issue means a lot to me when I have to look at all of our seniors and we can only help 80 people that are already on the program, which means there's no wait list or anything else. There's no chance of getting help here. So we have to really look at that. Thank you so much.
Thank you.
Thank you. Mr. Fallmeyer has a question.
Yes.
I'm sorry, Leonard Fallmeyer, District 4. The authority for the match or the help, or where does the authority come from?
Yes, so there's actually an NRS, NRS 706.8825, and it details that the program relies on excess revenue collected by the taxi cab authority above $200,000 to subsidize transportation for eligible older adults and people with a permanent disability. So that's where it's coming from.
All right, so then, according to the audits that you're getting from the taxi company, the revenue that you're now receiving is reflective of that. And the prognosis is dependent on how big a share Uber and Lyft gets, huh?
Essentially, yes.
Thank you.
Any more questions? Okay, I'm going to go ahead and pass it on to Kirsten Colum. She is from Nevada Health Authority.
Thank you so much, Ms. Morales Romanos. Can you see our presentation still?
We can. I don't see it, but I can hear it.
Oh, perfect. Thank you so much. I appreciate that. So yes, Kirsten Kulam for the record. I'm with the Division of Nevada Medicaid with the Nevada Health Authority. And thank you so much for having me back. It's a pleasure to be here. And yes, transportation, as many of your previous speakers have testified to, is always an area that can use improvement, particularly in Nevada. I think I'll speak to it in a little bit in terms of the challenges in the rural areas of finding transportation, but really that can't stress enough and really echo the previous comments of how transportation really, I think, ensures individuals aren't isolated and really have access to all those services that they need. So I'm going to, we can go to the next slide, please. Perfect. So I'm going to give just a quick overview of what our transportation is. We call it non-emergency medical transportation. Nevada Medicaid does cover emergency transportation as well. So if you think of the lights and sirens for an ambulance, we also cover air ambulances. So that's not on the topic for today, but just wanted to say that's why we kind of specify this non-emergency medical transportation, also affectionately called NEMAT. And then I'm just going to go give an overview of examples of the modes of transportation that Nevada Medicaid covers, talk about how it's authorized, and really kind of explain how that's scheduled. So we can go to the next slide. And actually, if we could just skip to the next slide too, I think that perfect. Okay, thank you so much. So I know we've talked about Nevada Medicaid a couple of times before this forum, but it's a complicated program. So just want to take a minute to just do a friendly reminder that Medicaid is one of the larger health insurers in Nevada. So you have Medicare, which is available for seniors. Medicaid is available for low income, and so who we cover in Nevada Medicaid is almost about 700,000 people. So it's 1 in 5. During COVID, we were serving 1 in 3. So when I'm speaking to this, to our transportation services, it's really available to many individuals in Nevada, and who utilizes it is often our seniors who are eligible for both Medicare and Medicaid, so our dual eligibles. And so for Medicaid, I know you've had a lot of presentations today that have all different program requirements and limitations when it comes to transportation. So for Medicaid, there's really 4 areas that are really paramount to accessing transportation. So number 1, Medicaid does offer transportation, but the individual in Nevada would have to be first and foremost eligible for Medicaid. So they would have to meet those kind of income standards and be on the Medicaid program. And then we also cover transportation to Medicaid covered services. So if it were, we often will get requests to take someone to the food bank, which we would love to do, because we know that that's an integral part of a person's life to be able to access, food and not have food insecurity. But that, like going to the food bank, is not a Medicaid covered services. So we're covering really those more traditional medical services, similar to what Medicare covers and more. So the second tenet is that the transportation is to a Medicaid covered service. The third is that we are taking the individual to a Medicaid service that is going to be by an enrolled Medicaid provider. So we have multiple healthcare providers, but they do have to be essentially credentialed and enrolled with Nevada Medicaid. And so they couldn't go to someone that wasn't ultimately going to bill Medicaid for the service. And then really the last kind of fourth tenet is that it is the most cost-effective mode. So as we kind of spoke to, taxi cabs, Uber and Lyft, the transportation network companies, those are always, oftentimes ideal for individuals because, you're picking someone up directly at their door and taking them to a different location, oftentimes more comfortable, as the forum member mentioned. So, but we do have that requirement to be fiscally responsible for our state and federal funding that Medicaid is paid for. So our transportation services, I'll talk about it in a minute, goes through a kind of a prior authorization requirement, and one of those components is to ensure that it is to a Medicaid covered service by a Medicaid recipient to a Medicaid covered provider, and it's the most cost effective mode of how to get there. I will say some good news though. It sounds like there might be some limitations with other with other programs, Nevada Medicaid doesn't have a limitation on the number of rides or a cap. So we really, the purpose of us covering transportation for our Medicaid covered services is we want recipients to get their health care that they're eligible for, and that helps them stay healthy. And so that's why there's not necessarily like a limit. So that is the good news. And thank you so much for going to the next slide. Okay, perfect. So similar to how, what was mentioned on some of the other programs, this is a list that Nevada Medicaid covers. So we do cover those, essentially the buses that are on those fixed routes. So just what you would think of a typical public bus. And then we also cover the door-to-door and curb-to-curb. So that paratransit, I believe you might have a presentation later from RTCs. And so I'm sure they'll go into a lot about what paratransit is, but that is a mode that we cover. Individuals often are taking that to our, like to adult day healthcare centers, or to, for individuals with intellectual disabilities that are going to their jobs and day training. So those are kind of our public modes of transportation that we cover. If someone maybe is able to be able to navigate and have the ambulation to take a public bus, we do cover those bus passes to assist them. Would just add in that caveat, it would really be the bus passes would be because they're going to a Medicaid appointment. And then if we do have individuals that are able to drive themselves, or they have family members that are able to drive, or friends, really whoever, we do offer gas mileage reimbursement to ensure that they can get to that appointment, to that Medicaid covered services. And then we do have some individuals that take the train. Oftentimes this is from Elko into Reno, so we have individuals that prefer to take the train in. And then because Nevada Medicaid, sometimes we don't always have the services in state, and so recipients may need to go out of state to receive their specialized services. We do cover out of state travel for commercial airlines, and then of course would cover any of that transportation when they are in that other out of state location. And then really for our non-emergency medical transportation, kind of the highest mode of transportation, if we think of the modes of kind of a continuum from the public bus to, trains and gas mileage, our highest mode is a stretcher vehicle. So it's not necessarily ambulances. That's where we would have that covered under our emergency transportation. I will say too, I'll just add, when a recipient does have to go out of state and might be in that travel status for going with the airplane or whatever that scenario might be, we do cover meals and lodging when they're out of state. So it's not necessarily a mode, which is why it's not listed on here, but we would cover the lodging and a meal when a recipient if they need an attendant to go with them, we would cover that when they are receiving those medical services. And then the next slide, thank you. So Nevada Medicaid, we offer services statewide, so therefore we do, we're required to offer essentially our transportation statewide. We did have a change recently though, so just friendly reminder with Medicaid, we have two service delivery models. So we have our Medicaid managed care that we have the majority of our recipients are receiving their healthcare services and authorizations through managed care. And then the other side, which is actually where our seniors and aged population and disabled are in our fee-for-service, which is not through a Medicaid managed care model. So the recent change is that in the rural areas, we went to statewide managed care starting in January of this year, and part of that also included the transportation be covered by managed care in the rural areas. And so that is the first time in Nevada that we really had this kind of split between transportation. Typically for our non-emergency medical transportation, we've had one broker that covers it statewide. And so that is a change to how someone is accessing transportation. So we have two essentially brokers. So we have MTM, which is for everyone that's in fee-for-service and in the urban areas if they're on managed care. And then if you're in the rural areas, if you have a Medicaid recipient in the rural areas, that's on one of our two Medicaid managed care, that broker is Safe Ride. So that is, it's different for us, but I think there's always, pros and cons, I think, with changes. And we were just in our Administrator Jensen and myself and others of our Medicaid and Nevada Health Authority team were just in Hawthorne yesterday, and as well as Winnemucca. And so that feedback was it's going well for that safe ride. Always have room for improvement for transportation, but at least that is some positive feedback we received just recently as of yesterday. And one more slide. Okay, perfect. So this is just thinking of that kind of like the split, the bifurcated way to schedule. We tried to put together, hopefully it's not confusing, but we tried to put together a way to, if a Medicaid recipient is trying to schedule their transportation, this is sort of the path that they would take. So if the recipient lives in rural Nevada, depending on if they are on managed care or if they're fee-for-service, those would be the numbers that they would contact. And then anyone living in urban areas, so urban area would be Clark County or Washoe County, then they would just contact MTM. And I will say just, in terms of the transportation challenges, I'm sure no surprise to the forum members is that, we still try to find ways to improve our transportation in the rural areas, having providers. A lot of recipients that live in rural areas are traveling to the urban area to have their receive their Medicaid services. Telehealth is certainly a great option, particularly post-COVID. I know that's utilized a lot, but we still have recipients that are leaving their rural community and coming into the urban, so they'll need a ride from the rural area into the urban and back. And one of the things that historically has been a challenge with Medicaid transportation is that we do not pay for what's called an empty trip. So we can only pay when the Medicaid recipient is in that vehicle. So when the provider has picked up that person and transported them. So that challenge is exacerbated in the rural areas because they're traveling a far distance, let's say from Las Vegas to Tonopah to pick someone up in Tonopah. That trip from Vegas to Tonopah, when the recipient's not with that provider, is considered empty because they're not there. But once that provider could receive reimbursement from the broker on behalf of Nevada Medicaid when they have that recipient from Tonopah to Vegas, but then of course that recipient has to go back. So really those kind of legs of the trip is challenging. And then also wait times. A lot of times providers, it might take longer in the doctor's office than anticipated, if the recipient doesn't get in right away to the doctor. And so then that whole domino effect of the scheduling and waiting. And so, being able to offer flexibilities for that provider to be able to wait for that recipient, when we have a ride identified and getting them back. So we are looking at, Nevada Medicaid is looking at some federal flexibilities that we could potentially try to offer some form of incentive for the providers to service our rural areas, and looking at potentially some budget initiatives to try to increase our transportation in the rural areas, because it's equally important. Regardless of where you live, you should have access to transportation. And then I think that is it. I'm happy to answer any questions. I know I went fast, and happy to give more detail on anything.
Thank you so much. Do we have questions from the forum? Forum members? Marilyn Jordan, District 9, I have a couple of questions. We have a population of close to 35 to 40% seniors in Nevada, and we're only addressing Medicaid recipients who are income driven. Is that the case?
In this, yes, for where the presentation I just went over, yes, unfortunately it's available to Medicaid recipients. I would say though, Medicaid tends to be, for low-income recipients, it tends to be the biggest payer, a health insurer for our seniors. They're often on Medicaid, can be.
Well, given that our national medical program is no longer in effect, that means that we have a lot of Medicare people that are in need of assistance, but you're not providing that any longer?
Kirsten Kulam for the record. So we have continually offered transportation for Nevada Medicaid, there hasn't been a change to our transportation. I'm not sure if you're referring to like Medicare Advantage plans that may have changed how they offer transportation. Nevada Medicaid does have a dual special needs program. It's a coordination only program that individuals that are on both Medicare and Medicaid or have Medicaid cost sharing can sometimes get access to additional services through that Medicare Advantage for transportation, but it is limited as I understand it.
So basically, all those people that are in between that income level has no services at all for Medicare.
Yeah, I can't, Kirsten Cohen, for the record. Yeah, I'm not an expert on Medicare because I really can only speak to Medicaid, but as I anecdotally understand it, it can be challenging for individuals that are only on Medicare and if they have transportation needs.
Yeah, and that's a big part of our population. Another question that I had on your presentation, you had the Older American Act. That started in 1991 and has not been updated this past year. Is that still in effect?
You know,
and how are you being?
Yeah, Kirsten Cohen, for the record, I'll actually give that to Ms. Knighton because I think that might have been in her presentation.
Okay.
Part of it, if that's okay. Okay.
It wasn't directed at you, it was directed at the question. Since it hasn't been re-upped, I want to know where we are with it.
LaDon Knighton, for the record, and you are correct, it has not been reauthorized. However, the state still continues to receive allocations.
I know that for the last 2 meetings, we've had somebody referring to the Older American Act, and a lot of the funding has been withdrawn from that supports many initiatives that address senior issues. And I was just wondering how you've been affected by it directly.
That's a great question, LaDon Knighton, for the record. Yes, we have, because the funding is limited. We have received allocations. For the most part, it has been flat funding, which doesn't help the organizations that we fund for services to the community because costs are rising.
Right. So I think that in listening to all of the presentations that I've heard this morning, most of it has to do with affordability and most of it has to deal with reductions. I'm not hearing anything that's increases across the board, which is sad. But I think that's something that's been supported since 1991. All of a sudden in the past year, it's just dropped. So we need to look at that seriously, and please get back to us and let us know if that's authorized at some point. Thank you very much. I really appreciate your presentation this morning, and just smile a little with those long faces. I know it can only get better. We have to look up. Okay, thank you. Anybody else have any questions? No? Thank you, forum members. We appreciate the presentation. Who's next? Here's my little page. We are now on agenda 8, an overview of public transportation programs for seniors available in Southern Nevada, fiscal challenges, gaps in services and policy considerations. Glazier, our Deputy Chief Executive from Regional Transportation, will take on that initiative and speak to us. Thank you. You may begin. And we want to thank you for your time and effort this morning. I know we've seen your happy face here for a good while, so we're glad to hear from you.
Thank you very much. Good afternoon, and thank you for having me today. My name is Teresa Gazer. I am the Deputy CEO of the Regional Transportation Commission of Southern Nevada. I am excited to share more about who RTC is, the role we play in our community, and some of the programs and services we provide for seniors, veterans, and paratransit users. Even if you don't ride transit, you rely on somebody who does ride transit. Before we take a deep dive into these programs, I just want to take a moment to explain our various roles and responsibilities in improving mobility in our community. The RTC is a complete mobility system that is more than just buses. We help plan, manage, and operate the region's transportation network. We manage public transportation, including traditional transit and paratransit services for those with disabilities. We serve as the regional planning agency working with local partners to plan and fund roadways. We also manage Southern Nevada's traffic system, including traffic signals and freeway message signs, keeping the valley moving. RTC is unique since we are the only public agency in the country where all of these functions are under one roof, allowing us to deliver a complete transportation network more efficiently and effectively for our growing region. If you don't ride transit every day, it could be easy to underestimate just how important it is to our community. Each year, RTC provides more than 58 million passenger trips across Southern Nevada, roughly 160,000 trips per day. Behind every trip is a purpose, a person, and a destination that matters. Nearly 1 in 5 transit trips serve students, seniors, veterans, and persons with disabilities, riders who rely on transit the most. For students, transit provides access to education and workforce opportunities. For seniors and veterans, transit supports independence, healthcare access, and connection to essential services. Paratransit provides mobility services for individuals who cannot use the traditional transit system and remains essential to maintaining independence and quality of life. Transit is a lifeline, not a luxury. But transit doesn't just stop at students, seniors, veterans, and paratransit. Transit supports the people who move Southern Nevada every day: workers and job seekers, caregivers, families, and visitors. Transit provides families and caregivers with reliable access to schools, medical appointments, and essential daily services. It connects employees to jobs across all hours of the day, including the early morning and late night shifts that power our regional economy. It helps visitors move throughout the region and supports the resort corridor that drives Southern Nevada's economy. These are not abstract groups. These are your neighbors, your friends, family members, and the workforce that keeps our community connected. For those who are unfamiliar with our service area, this is a map that most accurately represents our current service area. We are aware that there are areas in our region that we have not been able to sufficiently service, like Anthem and Southern Highlands. Like many growing regions, Southern Nevada continues to expand, creating new transportation needs. While some areas of the valley have seen significant growth in recent years, transit expansion requires careful planning to ensure service is sustainable and effective. Our goal is to connect residents with the places that matter the most, whether that's work, school, healthcare, or everyday destinations. As we plan for the future, RTC evaluates growth trends, community needs, economic development, rider feedback to determine where we can make the greatest impact. It's all part of ensuring our transit system grows alongside our region and continues to support Southern Nevada's future. RTC provided nearly 1.7 million paratransit trips across Southern Nevada in fiscal year 2025. That's essentially July of 2024 through June of 2025. Paratransit is a reservation-based shared ride door-to-door service that is available to eligible customers who are physically or cognitively unable to use traditional transit. Eligibility is determined through an evaluation process that assesses an individual's ability to independently navigate that traditional transit system. This service operates 24 hours a day, 365 days a year and serves the urbanized area of Clark County. RTC is continually looking for ways to improve mobility for paratransit customers. Through partnerships with supplemental transportation providers and our paratransit Ride on Demand program, eligible riders have access to more flexible and convenient transportation options. These programs help increase mobility, reduce wait time, and provide reliable access to essential destinations throughout the community. RTC also offers specialized services designed to help seniors maintain independence and stay connected in their communities. In fiscal year 2025, RTC provided nearly 49,000 trips through programs tailored to older adults, including Silver Star and flexible demand response services. With 13 routes throughout the valley, Silver Star connected senior communities to shopping, community centers, healthcare, and other key destinations, helping older adults stay active, independent, and connected. Flexible demand response provided door-to-door service in select communities, including Sun City's Anthem and Summerlin, as well as Centennial Hills, helping connect residents to RTC's broader transit network and essential destinations. RTC also offers mobility training programs, including Seniors on the Go, which provides free training to help seniors and other riders navigate the transit system, plan trips, and travel independently using the transportation options available throughout the region. RTC is committed to supporting the mobility needs of veterans throughout Southern Nevada. In fiscal year 2025, RTC provided more than 38,000 trips to veterans throughout a variety of transit programs and services. These efforts include the Veterans Medical Transportation Network, which provides free transportation to eligible veterans traveling to VA-approved medical appointments, as well as reduced fare transit programs and direct connections to key veteran healthcare facilities throughout the region. Together, these services help ensure veterans have reliable access to healthcare, community resources, and other essential destinations. Now we need to talk about what is ahead for the RTC. The RTC is facing a structural funding challenge. Simply put, the cost of providing service is growing faster than the revenues that support it. And without a long-term funding solution, there will be real impacts to the services our community depends on. Today, the RTC faces an estimated annual budget shortfall of $118 million. This challenge is not the result of mismanagement. It reflects rising operational costs, inflation, labor and insurance increases, growing service demands, and a funding structure that has not kept pace with the Southern Nevada growth. At the same time, RTC's primary funding source, 3/8 of 1% sales tax, has remained unchanged since 2002. The result of this imbalance, which creates the long-term funding challenge we are looking at today. And because of a $118 million annual budget shortfall, the RTC has already begun making difficult financial decisions to slow the growth of the deficit and provide services for as long as possible. We are not waiting to act. We are exploring every possible option. We have already implemented budget adjustments across our organization, including deferring capital projects, reducing internal costs, and limiting the expansion of transit services. And after 15 years without increasing current transit fares, the RTC is looking into increasing our passenger fares, a decision we did not make lightly. These actions reflect our commitment to being responsible stewards of public funding and doing everything possible internally before asking the community to consider broader long-term solutions. But even with these adjustments, they are not enough to close the projected annual shortfall of this magnitude. And at some point, we are projecting in 2028, continued cost and limited revenues will begin impacting the level of service we can provide to Southern Nevada. Ultimately, this conversation is about the kind of region we want Southern Nevada to be. Public transportation is more than mobility service. It is critical infrastructure that supports our workforce, economy, healthcare system, and quality of life. Without a long-term sustainable funding solution, the region would face significant service reductions across the transit network, including impacts to traditional transit, paratransit, senior, and veteran services. Potential reductions may leave thousands of eligible customers outside the service area and eliminating specialized programs such as Silver Star and the Veterans Medical Transportation Network. For many residents, this would mean reduced access to healthcare, employment, education, and other essential destinations. With a long-term funding solution, we can continue providing reliable transportation, preserve critical mobility programs, support future growth, expand opportunity, and ensure Southern Nevada remains connected and competitive for years to come. Because transit is not just about moving people, it is about supporting the people and communities that keep Southern Nevada moving. Looking ahead, the RTC is not simply identifying the challenge. We are actively working towards a long-term solution. Over the next several years, that work will include engagement at both the legislative and the community level. During the 2027 legislative session, we will be working with policymakers and regional partners to advance long-term transportation funding discussions. We are exploring a variety of different revenue options. And ultimately, in 2028, the community may have an opportunity to decide on a ballot initiative that would create a sustainable funding source. But this process cannot happen in isolation. That is why we are asking the community to get involved by staying engaged, staying informed, and helping shape the future of mobility in our region. So I encourage you to use your voices and your cell phones to help us shape the future of public transportation here in Southern Nevada by becoming a transit champion. As a transit champion, you can tell your story on camera and highlight how transit impacts you, your family, and your community. You could share your support for public transit with state and local decision makers. You can request RTC of Southern Nevada to present to your organization, neighborhood group, faith, community, business, or civic association, and stay informed about transit funding, service improvements, and opportunities to get involved. So I invite you to scan this QR code today to get started, because even if you don't ride transit, you rely on somebody who does. Thank you for your time today, and I appreciate any questions you may have.
Forum members, do we have questions? Up north, questions? I recognize Mr. Slaughter.
Frank Slaughter, Senate District 11. The question is with the QR code, could I take that out to the community and say, take a picture, tell me what, on your cell phone, and just talk about what public transportation means to you? I think that's a good idea.
Thank you so much, Teresa Gazer, for the record. I appreciate your question, and that is exactly what our intention is. We want to make sure that this QR code, as well as the information available on our website and for all of the public forums that we will be reaching out to over the next 7 months before we head to legislative session, have access to that QR code and a way to share their story. So yes, we will have material available, but you are also more than welcome to share that with anybody you choose to. Thank you for that question.
Marilyn Jordan, District 9. I have a question, and I want to know what impact the gas prices are to your current financial position.
Thank you again for that question, Teresa Gazer, for the record. So what I can tell you is we have a mixed fleet of over 1,000 different vehicles between our paratransit fleet and our traditional fixed route bus fleet. The majority of our fleet runs on compressed natural gas, so not as dynamic a price fluctuation as we are seeing with other gas vehicles. We do have some gas vehicles, we do have some diesel vehicles, and we also have a few hydrogen vehicles as well as electric vehicles. So at this time, that is not as big as a factor as what many other public transit agencies are experiencing that are more closely tied to their fleet being gas or diesel driven.
Okay, the second part of my question is, the second part of my question is not really a question. It's really an acknowledgement in support of the traffic situation is outrageous with all of the construction that's going on. And I have to tell you, I salute your drivers tremendously because they have a lot to contend with all over town with all of the construction and having to work around it. And the other day I saw a bus driver, he was just sitting there saying, please, you know. The other comment is, I will say that the gas problem has increased your utilization of the buses tremendously. I've never seen so many people standing at bus stops these days waiting for the bus. Actually, I've learned where bus stops are that I never knew existed. So I just wanted to let you know that we appreciate all the hard work that's going on there. And please extend our thanks to the bus drivers because I know they have a lot to deal with.
Thank you so much. And we do very much appreciate those comments. We are seeing an increase absolutely in the number of people who are choosing to ride transit with the increase in some gas prices, and our bus drivers are outstanding. Thank you.
We have a bus driver over near in my neighborhood, and we gave him some donuts and coffee the other day because he had to wait so long to get by. So thank you. We appreciate your being here this morning and sharing with us what's going on with transit in town.
Thank you.
Oh, excuse me. Mr. Phil Crowd has it. Phil.
We go. We're back on. Fred Silvercross, District 5. Two concerns that come to mind. One is safety becoming more or less of a concern, and if so, how is it being addressed? The other factor is with the rise of autonomous vehicles, some of which are being priced very inexpensively, how do you see that affecting ridership in the near and distant future?
Thank you so much for your questions, Teresa Gazer. For the record, so safety is something that is near and dear to our heart at the RTC of Southern Nevada. We are always actively engaging with the community, such as Clark County's Office of Traffic Safety and all of the local jurisdictions, as well as NDOT on the state level, to see what we can be collectively doing as a region to improve some of the safety trends that are happening in our valley, including the pedestrian incidents that we've been seeing a rise of. We sit on various committees as our role as both the Metropolitan Planning Organization, the Regional Traffic Management Center of the Valley. So those are things that we are actively working on through various projects and grants within our agency. I don't know if that addressed your question regarding safety.
About 90% of it, yes. The other point might be, are the buses now equipped with two-way communications and video assist in the event of emergencies? I had heard talk that was happening, but I don't know if it's an actual fact.
Yes, thank you for that question. And yes, I can absolutely address that. We do have two-way communication with all of our buses through our bus operations center. They are getting direct support anytime they are on the road. We contract out our bus operations to a contractor, and they are constantly monitoring the conditions going on inside the bus in real time through video feeds. I believe that was your question. And then in addition to that, we have made a very concerted effort over the last few years to improve our number of safety officers that are both at our bus transit centers as well as circulating on our bus routes and at our bus stops.
Thank you. One last point. Is the RTC involved in establishing, maintaining, and hopefully improving the safety of the bus stops with crash barriers or better protection facilities for people waiting to use at the bus stops themselves?
Thank you very much for that question. Yes, RTC is the owner of the bus stop location. So we are always engaging in ways to provide more safety at the bus stops. In many of our transit centers, there has been the installation of bollards at some of the high loading bays. And then in addition to that, we've improved our lighting when possible out at our bus stop locations, as well as providing better shade and shelters at our bus stop locations. If I may, you had also asked about the question of autonomous vehicles and how that is taking a place of the market share. I think just the way that we saw the emergence of rideshare come onto the market several years ago, I do believe that there's going to be continuing opportunities for riders to choose which mobility option they find best suits them. And I do think that the autonomous vehicles will continue to come into this market, and riders may choose that as the most logical option for them. But we are continuing to look for ways to provide this transit service the way that we have served this community for all of these years.
Thank you very much. Answered all my questions.
Oh. The chair recognizes Ms. Levitt. You can go first. I'm trying to.
Hi, I'm Peggy Levitt from Senate District 20. I'll just be real quick because I know it's been a long day. I wasn't familiar with many of these other services offered that we've talked about today, but I have been aware of the RTC for many years, and I served on the city council out in Boulder City for a couple of sessions, so I became more aware of what RTC does, and I just think it's an outstanding service in so many ways that serves our community. So I just wanted to applaud you. And you mentioned the tax structure and how it hasn't changed in all these years. So are you approaching the legislature about increasing that this year?
Thank you for your comments, and I do agree that RTC is phenomenal, and we are very lucky to have it in our community. There are many discussions going on right now regarding what is the best path forward for continuing to fund RTC. So we're exploring a variety of options. There has not been one single targeted fund or of revenue for sources yet. Thank you.
Thank you, Ms. Levitt.
Oh, I'm sorry, if I may just add one more thing to that one. Okay. I do encourage everybody, if you are unfamiliar with any of the programs that I have mentioned in today's presentation, all of that information is available on our website, rtcsnv.com, senior programs, veterans programs, paratransit services. Thank you.
Thank you for that. And now we're going to hear from Mr. Thorne.
Thank you, Madam President. Patrick Thorne, District 12. Have not been a recurring user of the system, although I do admit having taken it to go to Raiders and Golden Knights games. And I noticed that the prices are extremely low. And given that I know you have increasing competition from other sources, it still seems like there's some opportunity there to increase prices. And what do you think might be a percentage increase you would consider in the future?
Absolutely. Thank you so much for that question. Teresa Gazer, again, for the record, we have recognized that we have not increased our fares in over 15 years. And there have been several opportunities where we have looked to try to consider raising fares. The last one was in 2020, which we decided was not the right time for that consideration. What I can tell you is that we do have a funding structure that we just finished. I'm sorry, I'm looking for the correct page. That we just finished our public comment on, our public comment period on with our new proposed fare structure, We are looking to go from $2 for our, apologize, thought it was right here. I can just have one moment to find the right sheet. Yeah. Thank you so much. Sorry. All right, so our single rider fixed route fare is currently at $2, and we are proposing to go to $3 with that. Reduced single ride fixed route fare is $1, and we're proposing to go to $1.50. We are looking to eliminate several of our standing passes and consolidate those down to the most used passes. And then additionally, we are looking to change our paratransit single rider fare, which is currently $3, and move that to a single rider fare of $4. There is a variety of other changes, but those are the most noticeable ones that are available. This is fully listed on our RTC website, even though our public comment period has closed. We are evaluating that as part of what is considered a Title VI analysis, which is required by the federal government to make sure that we are not disproportionately disenfranchising any particular demographic. So all of that analysis is currently underway. And then once we have those analysis results, we will be reviewing them to see what is our final recommendation to our RTC board. And based on those outcomes, we will consider when is the appropriate time, anywhere up to the next 6 months to 12 months, to enact those new fares if they are recommended.
Thank you. Of course, selfishly, we hope you're not going to impact the seniors too much on those increases. But appreciate your comments.
Thank you.
Thank you, Mr. Thorne. I have a question. Marilyn Jordan, for the record, District 9. Do you have a senior fare?
Yes, that is the reduced rate fare, which is half of what the standard full fare is.
And what is that fare?
So for a single rider, that fare is currently $1. It would go to $1.50, and
it's $1?
That is correct.
That's the senior fare?
That is correct.
And what do you have to do to get a senior fare?
You would just have to contact any of our transit centers or our main administrative building, and they would sign you up for the reduced rate.
Okay, so they're paying $1, and if that were to go up, what would the recommendation be, to $2?
So for the increase for the reduced fare, which seniors are eligible for, is recommended at $1.50 in the future.
$1.50. Okay, good. That's great information.
Absolutely.
And that's something clearly that we will discuss.
Okay.
Thank you so much for your presentation. We're excited to hear from you and knowing that we want to support whatever we can to help you. Have a great day, and we appreciate you having to wait and that you still are smiling.
Thank you so much. I appreciate being here today. Thank you for letting me take some of your time.
No problem. At this time, we will deal with agenda item number 9. These wonderful ladies that have been here all day long are still happy to be here. So we thank you for coming. Mr. G, we want to hear from you, so you have the floor.
Good afternoon, everyone. My name is Jim Gee. I'm the Director of Public Transit for RTC Washoe in Reno, Nevada. I want to thank you and commend you for sticking it through a very long day, and also commend you especially throughout the process, because senior citizens is such a critical issue for the state of Nevada. So kudos to your group for all the hard work you're putting in and the time you're putting in. My presentation today will outline, very similar to the last presentation, the outline of transit services that are provided by the RTC for us in the Reno-Sparks metropolitan area. Very, very, very similar to RTC of Southern Nevada. We are not only the transit provider, we are also the construction and engineering arm for road projects, and also what's called the MPO, or the Metropolitan Planning Organization, that does the long-range transportation planning. I will briefly go through our transit options. First is our fixed route service, which is typically what people think about when you think about public transit. It is 40-foot buses stopping at signed bus stops following a set schedule. The service is 24 hours a day, depending on the route, 365 days a year. And this type of service is our most efficient in terms of passengers per hour, and also our most effective in terms of ridership. Last year, we had approximately 6 million trips on our fixed route service. Demand is up with ridership increases in 45 out of the last 46 months. And just as a side note, the primary reason that people use public transit is to go to work. And yes, we have a lot of seniors. Yes, we have a lot of students. Yes, we have a lot of people going to shopping and medical and so on. But economic development and getting people to work is really our bread and butter, and that is the number one reason that people use public transit. Here in Reno, we have what's called bus rapid transit on 2 routes. These are high-frequency bus routes that have larger stops, limited stops, and they basically create a north-south and east-west backbone to our system. Those 2 routes together combined for 1.5 million trips last year. It is a very popular service for us, especially our Virginia line, which on the northern end of the route has the University of Nevada, Reno, and on the southern end of the route has Meadowood Mall, and in between a neighborhood called Midtown, which is very popular for visitors and students. So that backbone of our system is our bus rapid transit. Our regular price for using RTC, same as Southern Nevada, is $1.50 per ride, with a senior discount of 75 cents per trip, or $1.50 per day. I'm sorry, it's $1 a trip and $1.50 a day for seniors. I note that all of our buses are accessible for seniors. They all have bike racks. In regards to the safety question earlier, they all have live camera feeds. They all have GPS units. We track every vehicle and know exactly where every bus is at every time. Our next type of service that I would like to talk about is microtransit, or what we brand locally as FlexRide. This is a on-demand curb-to-curb service that is available in suburban areas. It is open to the general public and operates as very similar to Uber or Lyft. In fact, we partner with Uber and Lyft in providing supplemental service to make up for when we are struggling in terms of capacity. Unlike Uber and Lyft, though, we have 3 key differences. One is it is a consistent vehicle. In this case, it's a small bus or perhaps a Ford Transit van. That vehicle has space for wheelchairs, space for service animals, space for packages, but it's a consistent vehicle from trip to trip. Secondly, it's a consistent driver, in that with RTC, you know that the driver has been properly trained, has been under a drug testing program, and has received many hours of behind-the-wheel service. And also, finally, a consistent price, in that from our version of Uber Lyft microtransit is the same fares as our fixed route system. $2 per trip, $3 per day, with half prices for seniors and persons with disabilities. We do constrain it geographically, so it does serve only certain geographic suburban areas. For those who want to go crosstown, the bus will connect you to a traditional fixed route vehicle, very likely, which is our ride service. But on this service, we have two major markets. One is, again, getting people to work, especially those first mile, last mile trips where they might live in the core of the city, but work along the fringe of the city where a lot of new jobs are. And then secondly, senior citizens. And on this service especially, we see a lot of seniors who they don't want to pre-schedule their trip, which you have to do on Access. They don't want to have to rely on their granddaughter or their niece or their neighbor to get a trip. They want to have some independence and be able to go to Walmart or the pharmacy or wherever they need to go. And so that's a big market for us. Our next service is RTC Access. This is our ADA paratransit service. It is a service that is application-based and eligibility-based, with the eligibility being that you physically or by reasons of disability are unable to use our regular fixed route service. With Access, the service is within 3/4 of a mile of a RTC regular route. So again, 24 hours a day, depending on the route. Access does travel curb to curb, door to door in the case of some folks, depending on their disability. And it will take you cross town or wherever you need to go as long as you pre-schedule that trip. It's a very popular service, and for those seniors who can't use fixed route and have to use Access, it is very likely their only means of transportation. So it's a super important part of our service. Additionally, for Access, exactly like Ride, the number one reason that people use it is to get to work. It is seniors and disabled who are working later in life, but because of various reasons have to still keep working to make ends meet. And so they're using Access to get to work. We also at RTC Ride have a very strong travel training program to teach people, especially seniors, how to use public transit. We have a very significant outreach program where we go to group homes. We will meet with individual seniors, teach them how to use Ride, teach them how to use Access, promote our public transit services. Because we recognize, for a lot of seniors especially, they haven't used the bus in many years. And so if you're in the position where you're finally having to give up your car keys, it's a very intimidating experience to have to think about, well, how do I use the bus? How do I figure out how to plan my route? How do I pay for my route? How do I tell my driver when I need to get off? And so our program goes out in the community and teaches folks how to answer all those questions to make sure that they're comfortable with using our service. Another one of our senior programs that we're very proud of is what we call the Taxi Bucks. And that is a program that we started many years ago. The current itineration of it is eligible for seniors over the age of 60, for veterans of any age, and for disabled Access clients of any age. And we will give you a card that is a $60 per month transportation benefit that they can use for taxi or Uber or Lyft. The card auto loads every month, so every month they'll get a new $60, but it started out primarily for folks who lived on the suburban fringe to get places within the core of the city. It's now expanded to all sorts of uses and benefits for seniors, but that $60 program every month that they use can be used for any purpose whatsoever. We also partner with our local nonprofits with a grant program that was formerly funded under Federal Transit Administration 5310, but is now being funded by local sales tax within Washoe County. These are funds that are used to buy vehicles, to provide drivers, to provide services to different nonprofits around the region so that they can provide transportation above and beyond what we can do ourselves. And so last year, we did those nonprofits listed below: Access to Healthcare Network, Neighborhood Network in Northern Nevada, Volunteers of America, Sanford Center for Aging at UNR. They provided almost 29,000 trips to seniors and folks who needed it in our community. And in addition to transportation services, we certainly at RTC want to be a great community partner. And so, one of the things we're also really proud of is partnering with different agencies on different initiatives. This is a photo here of our Stuff a Bus for Seniors campaign that was just a couple months ago with Colo and Target and the Reno Aces. And basically, it was a donation drive for seniors where we filled the bus with stuff that seniors need, but also stuff that you wouldn't think about, like hygiene products and diapers, adult diapers and household supplies and things like that, that seniors frankly need, and we can try to help them out. So earlier in the presentation, I mentioned how our ridership was up on RIDE. It is up for everything across the board. I will note this graph may be hard to read, but in the last 3 years, our Flex Ride ridership is up 150%. Our Senior Ride ridership is up 200%. This graph was as of the first of the year, and both of those programs since the first of the year are up another 40%. So we have a huge increase in demand in the amount of transportation that is needed by our seniors. And what is happening? We are frankly stepping back because of funding. Those same fiscal pressures that are forcing seniors to look at public transit and cut costs, things like inflation, things like insurance, things like fuel prices, have the same impact on us at RTC. So we're not growing our service. We're trying to constrain our service as best as possible at a time when the seniors need us more than ever. And that's a fundamental problem that I know Southern Nevada is going through right now also, and all of us in the transportation industry are going through right now. So what we are doing today is, for our Senior Ride program, we're moving it from age 60 to 65. We're looking at putting a copay on it for folks who are above the poverty level so that they would at least pay some portion of that cost. We're looking at increasing fares for our ADA services, and we're not increasing our base service level at all, even though we know that demand is there, because we don't want to put service out there and then immediately have to bring it back because of financial issues. So this is going to be an ongoing concern for us, managing our costs and managing the demand that we have. But most importantly for us is, of course, making sure that we provide the best service that we can for the seniors and all residents of our community. And with that, I would be happy to answer any questions about RTC Washoe. And thank you.
Thank you very much. We appreciate hearing from you. Forum members, do we have questions? Well, you were so dynamic, we have no questions.
Madam Chair, in the north, please.
Yes, Mr. Smith, please. We haven't heard from you today. We're happy to see you.
Thank you. Been quiet. I just have one question for this gentleman, and I know for a fact that RTC does a lot of road construction around the valley, and that's great. It's awesome. I came from construction, so I appreciate that. But I'm wondering, between the construction side and the transportation side, I'm going to just say, has your budget on the transportation side gone down? I mean, from the pot of money that RTC has?
So both the transit side and the construction side are struggling. At RTC, we're fortunate enough to have two major funding streams. We have a fuel tax that is used towards construction and cannot be used for public transit. And then we also have a sales tax that is primarily used for public transit, but a portion of which also goes towards road construction. The same inflationary factors that I mentioned earlier, fuel, insurance, inflation, so on, they're impacting the construction industry also, asphalt, concrete, cement, and so on. So both sides of the house, so to speak, are struggling with the same problem in that the cost for providing our services is not is outpacing the amount of revenue coming in.
Okay, that's great. I did not know that. I thank you for clearing that up.
Mm-hmm.
Thank you, Mr. Smith, and thank you, Mr. G, for being here. We certainly want to keep up with what's going on up there in Washoe, so let us know if there's anything else additionally that we can do to support you. Thank you.
Thank
Forum
you.
members, do we have any other questions? Thank you so much. At this time, we will address our facilitators, and that would be agenda item number 10, our facilitator reports on issues important to seniors. Our local facilitator is absent today, so we wish her well and hope that she will be back with us in August. But again, at this time, we'd like to hear from Mr. Smith, our northern facilitator. So, Mr. Gregg, would you like to have some words for us this afternoon?
Yes, thank you. I appreciate the time. In my kind of conversations around since the last meeting, it seems like the federal cuts to the SNAP benefits nationwide are finally starting to catch up to folks here at the street level, I'm going to say, because folks on the street are starting to feel it. I'm going to use my mom and her neighbor for example. My mom's benefits were reduced, and her neighbor was suddenly disqualified from any benefits from SNAP. So that's starting to hit home now, and it's a lot of folks in that community that are starting to feel it. I don't know if you've heard anything down there, but that seems to be the biggest concern right now is the SNAP benefit cut.
Do we have any comments from forum members? That has been an ongoing issue, Mr. Smith, both here and around the state, along with these increased prices. So again, I guess I said earlier, our theme is affordability. We are struggling all over, but we thank you for your report. We very much appreciate the work that you're doing. And I want to extend special thanks also to Ms. McAdoo for visiting centers this morning and coming on board to ask us some key questions. Thank you. We always appreciate hearing from you. At this time, I'm going to address closing remarks, which are agenda item number 11, public comment. I am opening our second public comment period. Public comments will be limited to 2 minutes per speaker. Forum members, please keep in mind that public comment is reserved for members of the public only. When providing public comment, clearly state and spell your name for the record. We will start with public comment for those in the physical meeting locations. Is there anyone in Carson City who would like to provide public comment? Hearing none, I will ask the question of our members in Las Vegas. Do we have anybody that would like to provide public comment? AVH, please add the first caller with public comment to the meeting.
To provide public comment, please press *9 now to take your place in the queue, or raise hand in your Zoom window.
Thank
Good
you.
afternoon, Chair and members of the committee. Can you all hear me?
Yes, we can, but you can louder.
I'm sorry, can you hear me now?
Please begin.
Okay, thank you. This is Dora Martinez with the Nevada Peer Action Coalition, and I want to take the opportunity to thank you all for sitting there and listening to everyone. I want to take the opportunity to thank James Gee, who I know very well. He is very engaged with people with disability and the elderly seniors population here in the Washoe County. And, you know, that old saying, actions speak louder than words, and they are very willing to work with the population. And I just want to thank him and his team and all of the bus drivers, south, north, east, and west. We thank you. And I also just want to say that when Uber and Lyft are picking up people with disability and they have a service dog and they turn them away or drive away or cancel the ride while the client is, you know, in the heat, in the environment, that's not very nice, and it is illegal. So I hope that this is bringing the attention to you all, that's why we choose RTC Flex or the RTC Access, the paratransit, or RTC Bus, because they are not allowed to turn people with disability who have service dog or even a walker away. Thank you and have a great day. Happy 4th of July.
Thank you so much. We appreciate hearing from you.
Chair, we have no additional callers for public comment.
Hearing none, we will move on. Thank you. At this time, we're going to address agenda item number 12, adjournment. This concludes our meeting for today. Our last meeting for this interim will be our work session on August 26th, starting at 10 a.m. During the work session, the forum will consider certain things. And at this time, I would like Mr. Ashton to speak on behalf of those items. Thank you.
Thank you, Dr. Jordan. For the record, Patrick Ashton, Research Division, LCB. So Dr. Jordan asked me to give members an idea what is going to happen at the work session on August 26th and what is going to happen before, actually. The forum will have its work session at this last meeting. And since about half the forum members are new, I wanted to give you an idea how that works. So the forum has one bill draft request it can vote on and submit to be considered by the 2027 regular session starting in February next year. And that is one vote the forum may take at this upcoming work session. In addition to a bill draft request, the forum may approve recommendations to send letters to specific agencies, individuals, or organizations urging certain action or include positional statements also in the forum's final report. And upon conversation with Dr. Jordan, we would ask all members if you have any ideas for such recommendations to please send them to forum staff by around the end of July. And then forum staff will work together with Dr. Jordan to review these recommendations and then see if they could be included in a so-called work session document. That's an overview of these recommendations that you will have up for consideration, which you will see then in August, which will be posted together with the agenda shortly before the August meeting. I hope that clarifies the process a bit. Members, do you have any questions?
Hearing none, thank you, Mr. Ashton. We appreciate that. Again, we want to consider all that we've discussed during the last 3 sessions as to what our BDR is going to look like. So please get back in touch with if you have ideas or thoughts or questions. So at this time, I'm going to, and our meeting is adjourned. Thank you so much. Yay. I think, Mr. Thorne,